We are now live. Thank you, Karen. So good morning, folks. This is the Thursday session on the budget for the Joint Standing Committee on Health and Human Services. We'll be working through a second day of considering the budget that we've been presented, and we'll be looking for places where we can readily agree and places where additional information that's been provided might adequately answer questions. So as we work through that process, we'll not be taking testimony. We will be going back and forth with the various resources we have, though. So let's start with introductions, and Representative Zager.
Thank you, Mr. Chair. Good morning, everyone. Sam Zager, District 41 in Portland.
You either changed rooms or have a new background.
Changed rooms.
Okay. Representative Lemelin.
Morning, everyone. My name is Michael Lemlin. I represent House District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Representative Stover.
Good morning. My name is Holly Stover. I represent House District 89, including the towns of Booth Bay Harbor, South Port Edgecombe, West Port Island, and part of South Bristol.
And I didn't see Senator Baldacci. So Representative Perry. Oh, there he is, Senator Baldacci. Sorry.
Good morning. I'm Joe Baldacci. I represent Senate District 9, which is the city of Bangor and the town of Herman. Thank you.
Representative Perry.
Good morning. I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Barron, Calais, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point.
Representative Griffin.
Good morning, everyone. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Kenduskeag.
Representative Craven.
Thank you. Thank you, Mr. Chair. Good morning. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Representative Madigan.
Which is part of Waterville and part of Oakland.
So you froze just briefly. Some of that may be on my end, but we may
Want me to do it again?
Sure.
I'm Representative Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
Thank you. And Representative Javner.
Good morning. I'm Representative Kathy Javner, and I represent House District 141, located in Penobscot and Washington counties.
Senator Moore.
Good morning. I'm Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Representative Meyer.
Thank you, Mr. Chair. I'm Representative Michelle Meyer, serving Southern Maine's District 2, which is all of Elliott and parts of Kittery and South Berwick.
And I'm Ned Claxton. I live in Auburn, which is one of the communities I represent in Senate District 20, along with mine at Mechanic Falls, Poland, and New Gloucester. The staff who's with us today, let's start with our analyst, Anna Broom.
Hi, I'm Anna Broom. I'm one of the two legislative analysts for this committee, and I work in the Nonpartisan Office of Policy and Legal Analysis.
And Sam Seneth.
Sam Seneth, and I'm the other OPA analyst for the committee.
And Luke Lazur is here to help.
Good morning. I'm Luke Lazur. I'm a senior analyst in the Office of Fiscal and Program Review.
And Karen.
And I'm Karen Thomas, happy to be the clerk for the HHS committee. Should you need any assistance, please email me at hhs@legislature.maine.gov.
Thank you. The other name you'll see on the screen here is Molly Bogart. We asked the department a number of questions during the first session, and she's here to help us get answers. If you'd like to introduce yourself.
Sure. Good morning. I'm Molly Bogart, Director of Government Relations for the Department of Health and Human Services, and Deputy Commissioner Mann is also with me in the attendees room when we are ready to start.
We can bring him in when we get now. And thank you for the 10-page memo. Somebody's been working hard in the department since Tuesday, so hopefully this will address most or many of the questions we have from today. So does everybody have the memorandum from the Department of Health and Human Services dated the 10th? Have access to that, and we'll rely on putting up pieces of it on a screenshot if we need to.
And what I hadn't done yet is upload it to the portal or somewhere that would make it publicly available. I'm not sure if that might be tricky since it's in AFA technically, but if there's a way for me to do that.
Molly, we can do that for you.
Great, thank you.
Okay, and Deputy Commissioner Mann is here too. Would you care to introduce yourself?
Good morning, everyone. Benjamin Mann, Deputy Commissioner of Finance at the Department of Health and Human Services.
Thank you for being here too. All right, so do we want to jump right in? Luke, I'll turn it over to you.
All right, great. So I think what we've done in the past is I will just sort of work my way through the document starting at the beginning again at line 1. I will read as much or as little as needed for the committee to then start their discussion around those items. And if you have chunks you want to do at any given time, you can always just do them. I will not be offended if I'm interrupted. So just jump in whenever you feel you want to. So we're on the green document, and we'll just start right at the top at line 1, and lines 1 through 3, which are in. Well, actually, sorry. Do you want me to share this? I should share this. Let me quickly pop that up.
So I'm going to count on the committee members to put up a hand if they have questions that the explanation doesn't answer, or they want some more information, or they want some more time with this.
Senator Claxton, do you want us to also prompt you whenever you get to a line that has something in Molly's memo, or no?
I've got Molly's memo here, so if I miss it, please speak right up. Don't raise your hand. Just say whoops or whatever. Yes, Representative Perry.
Yes, because this is a line that just is for resources to make sure that we can spend the resources we have. I would like to vote that in if we're doing voting in right now.
And I defer to the committee with any concerns about voting that in, or if you want to put up your hands or shake a head. This is the additional information that we got from the department. You want to take a minute to read that?
I just want to second the motion.
Thank you, Representative Craven. So I'm going to turn it around. If there's anybody who's uncomfortable voting on lines 1 through 3, could you put your hand up? It has to be the electronic hand because I can't see all the faces at once. And I'm not seeing any hands. So the motion on the floor is to move in. I'm going to need to be able to see everybody's hands, Luke. So can you stop sharing a minute?
You can.
So at this point, having not heard otherwise, I'm assuming that people are comfortable voting that. So members of the committee who are comfortable moving things in, can you raise a hand? Is everybody okay with that methodology? Looks like unanimous of those present. Thank you. All right, let's take a break. No, thank you for that. That's unanimous of those present, and the first 3 lines get moved in. Representative Javner.
I'm so sorry, but did we have a count on that? Like how many hands were raised?
I saw it as unanimous of those present. Would you like us to count hands? I'm trying to avoid anything where there might be other than unanimous acceptance, at least for the preliminary go around on this material.
I have 10, Representative Javner, if it's helpful, and that's because Representative Madigan didn't have her video on. So that's what I have at the moment. Just for the I don't know if this is helpful to you or not, but when we write the memo to appropriations, we tend to just say a unanimous of those present when they're unanimous. We don't list out the names. I don't know if that's useful to you, no, but that's what we tend to do.
No, that's very helpful. I did know that. I was just wondering if we needed to have the number for you. That's all.
I certainly write them down as best I can.
So Anna, if it goes too fast at some point, just tell us to slow up a little bit and we'll do it
Sure.
longer on screen.
Sure.
Thank you. Does that answer your question, Representative Jadner? Are you okay with proceeding that way?
Yes, thank you.
You know, it also, I don't know if this is useful, Senator Claxton, but you could also use your electronic hands because that makes all the boxes appear in the right place without Luke and me and Molly and so on in the way. So you could go up and down with those if you'd like.
Okay, I think I like that idea. All right. So the next item is 4 and 5.
Yes, so the next one's lines 4 and 5 in two Dorothea Dix accounts, the regular Dorothea Dix account and the disproportionate share account. And it continues and makes permanent a position, a public service health manager 3 position at Dorothea Dix. I think as we discussed, this is a position that is currently a limited period position and has been for a little while. This continues that limited position, but then makes it permanent so that there is actually headcount associated with the position. And I think as we discussed on Tuesday, the small amount of funding is because the funding is only for the period from when the limited position was expected to end through the end of the year, which is just a couple of weeks.
Thank you. Anybody uncomfortable with voting this item? Yes, Representative Perry.
I just wanted to vote to move it in.
Okay. So there's been a motion made and the second was from whom?
Second.
Senator Baldacci. Okay. So let's try the electronic hands. If there's any discussion of these items, lines 4 and 5.
Luke, I'll still need you to not share for a second, otherwise I can only see 5.
Sorry.
Are we voting the motion right now?
Yes, this is a vote, the motion.
Okay.
Okay.
Okay. Thank you. Thank you, Luke. Next lines are 6 and 7.
Lines 6 and 7, which are again both in the Dorothea Dix. One is in the regular Dorothea Dix and one is in the disproportionate share. And this restores legislative headcount and funding for 1 hospital nurse 3 position funded from other special revenue in DISH and general fund in Dorothea Dix Psychiatric Center for the new 18-bed inpatient unit at Dorothea Dix. This position was authorized previously, but the was not included in the baseline budget in error. So this is to add it back in.
Yes, Representative Zager. Representative Zager. So I'm moving. Representative Zager, did you have your hand up or again? Okay, still up. All right, me too. All right, Representative Perry.
I would like to move lines 6 and 7 in.
Second.
Seconded by Representative Craven. We ready to vote? Okay, all those in favor of moving it in, please raise your electronic hand. 4, 8, 9, 10, 11. Thank you. And remember to put your hand down so I don't call on you. All right, back to you, Luke.
All right, so next is line 8. This one was in the disproportionate share Dorothea Dix account Z225, and it provides funding for increased costs of travel nurses. And I will pull up, there was a question from Representative Javner on any sense of how long the need for travel nurses at will last. And the department's response was travel nurses are needed to fill staffing gaps in state line vacancies. Travel nurses are relied on more heavily today, given increased vacancies and the workforce shortage. Demand for these travel nurses will vary, and it is unclear how long increased rates and/or increased reliance on contract staffing will be needed. This initiative funds 6 contracted clinicians for part of fiscal year 22 and fiscal year 23.
That's line 8, and I'll check with the committee to see if anybody has any concerns about voting this line. Yes, Representative Meyer.
Thank you, Mr. Chair. I would move that we move line 8 into the budget.
Second.
Seconded by Representative Craven. Any discussion? Oh, yes, Representative Javner, I saw you.
Thank you, Senator Claxton. This won't be a unanimous vote, so I'm not sure how you want to proceed with that.
Do you need additional information to make your decision about how you're voting? I think is what it comes down to.
Yep, no more information needed, so we can vote if you would like. That'd be
I
great.
think that's fine. Yes. Okay. So there's a motion on the floor to move line 8 in. Thank you for bringing that up. And I will ask first, all those who are in favor of bringing in line 8, please raise your electronic hand.
So this time we're going to need you to hold a little longer.
Yep. That's 8.
Okay.
Okay, everybody, please put your hand down if it was up. And all those who are opposed to moving that in? Looks like 4.
Thank you.
Thank you. All right. Line 9.
All right, so line 9 was again in disproportionate share. Dorothea Dix, account Z225, provides one-time funding for the Dorothea Dix Psychiatric Center's roof repair and replacement project.
Yes, Senator Moore. No. Representative Lemlin, is your hand up still or again? Senator Moore, is your hand still up or again? There we go. Senator Baldacci.
I would move this item in.
Second.
Thank you, Representative Craven, for the second. The motion's been made to move this in. Is there any discussion? I'm not seeing any, so all those in favor of moving this item in line number 9, please raise your electronic hand. That's 11. Okay. And let me just check the chat here. Right. Thank you, Luke.
All right, so now we're on to line 10. Disproportionate share Dorothea Dix, account Z225, provides one-time funding for the renovation of patient bathrooms at Dorothea Dix Psychiatric Center to make them ligature resistant.
Senator Moore. No. Representative Perry.
I would like to vote line 10 in. Line 10.
Second.
Seconded. Thank you, Representative Perry. Any discussion about line 10? Okay, then we can go ahead and vote. All those in favor of moving item line 10 into the budget, please indicate by raising your electronic hand. And if I scroll quickly, I think that's unanimous of those present. Okay, did you get that, Anna?
Yeah, I think so. Thank
you. All right.
So next, line 11. in account Z225 disproportionate share Dorothea Dix provides funding for the purchase of a patient monitoring system.
Any discussion of that? Representative Stover, is your hand still up? Or?
Senator Moore, your hand is up as well. Did you?
There we go. So we have line 11 in front of us. Did somebody want to make a motion? Ask any questions? Representative Meyer?
Yes, I would move that we move line 11 in.
Second.
Thank you. Representative Perry, you had your hand up for a minute?
I was voting.
Okay, we haven't gotten that far yet. Any further discussion? Okay, all those in favor of the motion to move in line 11, please put up your electronic hand. I have 12. Thank you. Line 12 is next.
So line 12 is account Z225 disproportionate share Dorothea Dix provides one-time funding for a hospital-wide upgrade of the Wi-Fi system at Dorothea Dix Psychiatric Center.
As we proceed, I'm trying to find a place where I can put down everybody's hand all at once, since this is going to be an ongoing challenge. All right, so line 12 has been proposed. Does anybody want to make a motion?
I would move to pass.
Thank you, Representative Craven.
Second.
Seconded,
Second.
Senator Baldacci. Any discussion? All those in favor of moving in line 12, please put up your electronic hand if it isn't already up, or take it down if you didn't mean it to be up. Now we're at 11. Who did we just lose?
Representative Madigan.
Okay. All right, so that now we're at 11. Thank you.
No, she just put her hand up.
Oh, 12. Thank you.
So all together, let's lower our hands.
Try that. Okay.
All right, so we're on to line 13 at Riverview Psychiatric Center, account Z219, provides funding for contracted nursing positions at Riverview Psychiatric Center.
Any comments, questions about line 13? Representative Meyer.
Yes, thank you, Mr. Chair. I would move that we move line 13 into the budget.
Second.
Seconded. Representative Javner, did you have a comment?
Yes, I do. Thank you. Sorry, my space bar isn't working now for my volume. Yes, this won't be unanimous either.
Okay. And again, the question is, would any additional information influence your vote? Just to be sure. Okay, so the motion is made and seconded on line 13. All those in favor of moving it in, please raise your electronic hand. That's 8. And I'll wait for Anna to say okay before I say, please lower your hand.
I'm good.
Please lower your hand. Representative Meyer, if you want to drop your hand. And of those who are opposed, I see 1, 2, 3, 4 hands up. Very good. Thank you. Everybody got their hand down. We're getting better, people. We're getting better at this. Okay.
So we're on to line 14 at Riverview Psychiatric Center, account Z219, and this provides funding for the purchase of a patient monitoring system.
I'll entertain a motion to move in.
I would move to pass.
Representative Craven.
Second.
Second, Representative Perry. Any discussion? All those in favor of moving in line 14, please raise your electronic hand. That's unanimous of those present, 12. Thank you. Everybody put your hand down.
Now we're on to line 15. This is at Riverview Psychiatric Center, account Z219, provides one-time funding for a hospital-wide upgrade of the Wi-Fi system at Riverview.
I move it in.
Thank you. Thank you, Representative Craven and Representative Perry. And discussion, all those in favor of moving in line 15, please raise your electronic hand. 4, 8, 9, 10, 11, 12. Very good. Okay. Hands down, please.
Now we're on to line 16 and 17 at Riverview Psychiatric Center, account Z219, and the disproportionate share RPC account Z220. And this one establishes 4 psychiatric nurse practitioner positions in the Riverview Psychiatric Center program to improve the recruitment and retention of qualified healthcare professionals and avoid higher locum tenens contracts.
Thank you.
I would move it in.
Second.
So the motion's been made and seconded. Representative Craven and Representative Perry. Representative Baldacci, did you have your hand up or are you voting already?
I was gonna move it in, but now I'm just getting ready to vote.
Okay, and Representative Javner, are you moving it in or voting or have a question?
Discussion.
Discussion, very good. Okay, so Senator Baldacci, can you put your hand down since we're not voting at this point? Representative Javner, go ahead.
Yes, I would just say that this will not be unanimous either.
Okay. Thank you. All right, so I think that's the end of the discussion. The motion on the floor is to move it in. Line 16 and 17. All those in favor of moving it in, please raise your electronic hand. Wasn't hard enough to keep track of all of these people before we started voting. Now it's even harder because they keep moving around. So that's 8. So please put your hands down. All those opposed, please put your hands up. And that's 4. Thank you. Hands down. All right.
Now we're up to line 18. This is an account Z198 Mental Health Services Community, and this provides funding to achieve parity with main care cost of living adjustments for certain community behavioral health related services. And I'm going to go over to the memo from the department because they did have a response to a question from Representative Madigan where she asked specifically what state funded services are included in this line. This initiative funds services that the Office of Behavioral Health provides to uninsured individuals via contracts. The services include Section 17 services, assertive community treatment, daily living supports, community integration, community rehabilitation services, and Section 65 clubhouse, mobile crisis, and crisis residential. Note the Section 65 medication management is a separate budget initiative that aligns with the 25% rate increase as provided for in the biennial budget.
I'll move it in.
Second.
I'll second that.
Thank you, Representative Stover. Representative Craven moved it in. Is there any discussion? Not seeing any. We'll proceed to vote. So those in favor of moving in line 18, please raise your electronic hand. That's unanimous of those present. So I assume, Senator Moore, that you got your question answered, so you were comfortable voting on that. So note to myself. Okay, please, everybody put your hands down. Line 19. I think Representative Lemelin had a question here.
Yes, lines 19, 20, 21 are again some providing allocation to align with available grant resources. And so there was a request for the breakdown of the funds and how they're spent. So it says that the line 19, this line item provides allocation for federal funds received for the Child Care Development Fund through the American Rescue Plan, including child care stabilization grants, 18.3 million, child care subsidy program, parent fee portion, which is 12.2 million, and the child care subsidy program reimbursement based on enrollments, which is 5.3 million, and other activities. Additional details are provided in the Child Care Plan for Maine September 2021 updates.
So
I
I'll
would
go
be
to Representative Lemlin and see if that addresses his questions adequately.
I wouldn't say adequately, but I'm fine with it now.
Okay.
I move
Thank
it
you.
in.
So Representative Craven moves it in.
Second that.
Okay. Representative Javner, did you second that? Okay.
Yes.
So any further discussion? All those in favor of moving it in, please raise your hand. 12, 8, 19, 20, and 21. That's 12 votes. Thank you. All right, that gets us to line 22.
So line 22 is in the account Z206, Mental Health Services Children, and it continues 2 limited period social services supervisor positions that were established in previous financial orders, and 3 limited period social service supervisor positions, 1 limited period social services manager 1 position, 1 limited period data and research coordinator position, 1 limited period clinical social worker position, 1 limited period social services program specialist 1 position, and 1 limited period social services program specialist 2 position, all within the Mental Health Services Children program. And there was a question that went along with this, and it says, why are there different dates in line 22 and 23? And these are 2 different grants with different end dates. Line number 22 is the Children's Behavioral Health System of Care grant with a grant period ending 8/30/24. And line 23 is a Child Care Development Fund ARP grant, which ends 9/30/23.
I move it in.
Thank you, Representative Craven.
Second.
Is there a second for that?
Second.
Representative Zager, thank you. Any further discussion?
Yes, I have a question.
Okay, I'll ask Representative Stover and Senator Baldacci to put their hands down. Go ahead, Representative Javner.
Thank you very much, Senator Claxton. Can Molly or Deputy Mann tell us what the amount of the Children's Behavioral Health System Care Grant is? What is the full amount for that?
I believe it was right around $9 million. I can confirm and get back to you.
That being the case, would you like to table consideration of this, Representative Javner?
Thank you, Senator Claxton. No, that's good. We're just curious what the amount was. Thank you. That'll be good for us. You don't need to get back either on Deputy Mann with a confirmed amount. Thank you very much.
And you're comfortable voting on it now?
Yes.
Very good. So I have to admit, did somebody move this in yet? Yes, moved and seconded. Thank you. So line 22, all those in favor of moving it in, please put your hands up. That's unanimous of those present. Okay, line 23. Hands down, please.
So line 23 is in the Child Care Services account 0563, and it continues 1 limited period social services program specialist 2 position, 1 limited period social services manager 1 position, and 2 limited period management analyst 2 positions.
I would move it in.
Second.
Thank you, Representatives Craven and Perry. Senator Moore?
Yes, I would ask the same question that we did with line 22. How much was the grant money for this particular grant? What was the total of grant, I guess, total grant amount?
This, are we on line 23?
Yes.
Yes.
This was the American Rescue Plan portion that was provided to states for childcare services, and it was nearly $119 million.
Wow. Thank you.
And these are funds that have a 3-year time frame for spending, is that right?
This period ends September 30th, 2023.
Okay. All right. Any other questions? Okay, so we can vote. All those in favor of moving line 23 into the budget, please raise your hand. That's unanimous of those present. Okay.
So we're now on to line 24. This is in the 0563 Child Care Services account. It continues 1 limited period financial resource specialist position and 1 limited period community care worker position. These positions end on June 14th, 2025.
Representative Perry, is your hand up still, as is mine?
No, actually, I have a question.
Okay.
Are these also ARP funds, or is this out of the base grant?
Good question. It's actually, it was not American Rescue Plan. It's also not the base grant. It was provided under the Consolidated Appropriations Act that was passed on December 27th, 2020, I believe. That provided $30 million to child care facilities.
Thank you.
All right, does somebody want to move this in?
Can I move that in?
Please. Thank you, Senator Representative Perry. And Representative Craven, second. Any further discussion? All those in favor of moving in line 24, please raise your hand. That's unanimous of those present, the 12. Thank you. So hands down.
We're on to line 25, still in account 0563 Child Care Services, and it establishes 1 public service manager 2 position funded 100% federal block grant in the Child Care Services program to serve as the Associate Director for Child Care and provides funding for all other costs. There was a question related to this line from Representative Lemlin. What is the baseline funding for these services? And the Child Care Development Fund annually receives $35 million. The funding is used primarily to cover child care subsidy vouchers, but also supports staffing for child care licensing services, training, and technical assistance, and provides program personnel costs.
Representative Lemlin, did that address your question?
Yes, it did, Senator. And I'm just curious, with all the federal money that I see on these pages, why are we using any general fund money?
Specific to which questions? We're not using all.
To me, with all of, when I add up all the federal money that I'm told we're getting, it would seem to me that we would never have to use general fund money for this entire supplemental budget. It's a huge amount.
The allotment issues that we've covered, like the mental health block grant and the child care development fund, which were just voted on, have very specific requirements on what the funding can be provided for. And also these funds are one-time in nature. They will end in the near term.
Any other questions, comments? Senator Baldacci?
Just so we have more of an elaboration, I would just ask the Deputy Commissioner if you could give us some general description of how these funds will be spent statewide in terms of promoting childcare.
Which do you want to, which funds? The block grant
I'm
funds,
sorry.
the ARPA funds, or?
I am referring to specifically, hold on, I'll tell you which number. The block grant funds that are the one-time funds.
I'm going to defer to Deputy Director Mann for that, but I understood the block grant funds are annual. Did I misunderstand that?
We get a baseline appropriation of $35 million for the Child Care Development Fund. There were 5 major pieces of COVID-related legislation that passed Congress over the last 2 years. Notably, CARES Act and the American Rescue Plan were the largest ones, but the Consolidated Appropriations Act and the Replenishment and Enhancement Fund for the Paycheck Protection Program also provided funds.
So I'm sorry, I meant the one-time grant funds.
Okay, so I think that's line 19, and it relates to the question that Representative Lemelin originally asked. That $40 million that's slated to be spent in fiscal 23 predominantly would continue the stabilization grants that go out to childcare facilities, which includes $200 a month stipends to the 6,600 or so employees of those childcare facilities.
Okay,
We're also
so
covering
these-
the parent.
Yeah, so these are additional payments that are going to go out in the next fiscal year or in the next
fiscal 23.
July. Yeah, okay, starting in July.
Correct.
Okay, and how long does it take for those funds, would you anticipate to be able to be dispersed? Is it going to be throughout the fiscal year in allotments, or how do you guys plan on getting the money to the child care agencies?
Those funds have been flowing to child care agencies already since the beginning. We are putting this through the budget for transparency purposes. The stabilization grants in particular go until September 30th of 2023. And then it's related to the other childcare stipend bill that we'll discuss in the budget for nearly $12 million. There's a proposal that we work with the Speaker's office on to continue those funds going forward.
Okay, I appreciate the answer. Thank you very much.
Okay, so the motion has been made to move in line 25. It's been seconded. Is there any other discussion? Then I'll ask all those who are in favor of moving in line 25, please raise your electronic hand. Looks like 11. Who'd we lose?
Sam.
Okay. All right.
All right, so we're on to lines 26 and 27, and these are in the Homeless Youth Program account 0923 and the Mental Health Services Children account Z206. This provides funding for homeless youth services in the Mental Health Services Children Program and the Homeless Youth Program. There was a question related to this that was answered by the department on their memo. So the question from Senator Moore was how much was budgeted in past years for these services? It says that prior to the most recent RFP, homeless youth services contracts were funded at $4 million. Rep. Stover also asked exactly what services are being funded. And it says the department currently supports housing and responds to the needs of youth experiencing homelessness through 4 services: street and community outreach program services, drop-in program, shelter for homeless youth services, and transitional living program services.
We have 2 of those in Lewiston, so I move to pass.
Okay, Representative Perry, did you have your hand up as a question? Nope. Okay. Is there a motion? Yes, Representative Javner?
Thank you very much, Senator Claxton. This will not be unanimous.
Okay, thank you. Any other comments, questions related to this? Been moved in. All those in favor of moving in, please raise your electronic hand. 7 I count, Anna. And please put your hand down. All those opposed, please raise your hand. I count 4. Okay, thank you. Please lower your hand. Okay.
Next, we're on to lines 28 and 29. And these are in accounts 0137, which is a 4E foster care adoption assistance account, and account 0139, the state-funded foster care adoption assistance account. And this provides one-time funding for child welfare cycle payments. There was a question related to this that gets pretty long, so I will read the first couple. I'm not going to go through the entire table, but I'll put it up on screen. So the first question from Representative Perry was, what are child welfare cycle payments? Why the increase? During the time a child is in state custody, the state is acting as the child's legal guardian and is responsible for food, shelter, and ongoing care of the child. Many children also have significant medical and mental health needs, so the cost is often significantly higher to care for these children. Cycle payments are reoccurring payments that cover their expenses. Since 2018, the department has seen an increase in the number of children in care and has also seen the level of care needed to support these children increase. The combination of these factors has caused a shortfall projected in the child welfare accounts. The next question from Senator Moore was, how many licensed foster home and beds do we have, including kinship care? There are currently 1,675 resource homes, and resource homes include kinship care and non-relative resource foster homes. The number of beds fluctuates based on situation of families and the needs the children place there. And then Representative Javner had a question about what is the rate for foster care payments. And as you can see, there's a table that goes through the different rates paid depending on the type of location of the child in care.
Thank you, Luke. So yes, Representative Javner.
Thank you, Senator Claxton. I do still have just a couple questions that I would like answered. I did ask not just for, I don't see where this table includes those that have adopted children. Is that what this is, no matter if you have an adopted child or if they're still in the foster care system? And there was another one. It'll come to me. Just a second.
I think you're correct, Representative Javner. This does not include adoption subsidy. I don't have that information at the tip of my fingers, but I know Dr. Landry has been sort of on call for this hearing, and let me see if I can message him quickly to get a response for you before you vote.
Yep, and actually, I didn't remember my other question. Does this also, did these initiatives also include kinship care, though? I think that was one question that we had. And with that, so you don't have to rush Dr. Landry, I would ask just to table these lines for now, and then we can move on.
Sure.
Sorry. We can do that with a show of hands. All those who would like to table right now. That's unanimous of those present. Thank you.
And these do include kinship care.
They do include kinship care. Molly, is that what you just said?
Yes.
Okay. All right.
All right, we'll move on to lines 30 and 31, which is account 0452 OCFS district account. And this establishes 16 child protective services caseworker positions, 3 child protective services caseworker supervisor positions, and 1 public service manager 2 position in the OCFS district program.
Representative Javner?
I was going to make a motion to move in lines 30 and 31, please.
Thank you very much. Thank you, Representative Stover was the second, I think. All those in favor, if there's no further discussion of moving it in, please raise your hand. That's 11. And Representative Perry, did you vote or not?
I was just quick at lowering my hand after you mentioned the vote.
Okay, all right. If I get everybody, please lower your hand. All right.
Now we're on to line 32 and 33, and these are in the 0452 OCFS district account. And it continues and makes permanent 2 social services program specialists, 2 positions that were previously established in previous financial orders in the OCFS program. And similar to one we had above, these were limited period positions, and part of this initiative is to make them permanent.
Any question? Move them in, Representative Perry.
Second.
Can I move that in?
Yes, you just did. I think. And Representative Javner, you seconded. Okay. Any further discussion? All those in favor, please raise your hand. That gets us to 11. Okay. Now please lower your hand.
Now we're on to lines 34 and 35, which are both in the account 0137 4E Foster Care Adoption Assistant Program, provides funding for contracted staffing to support engagement between parents and the child welfare system.
Any questions, comments about that? Representative Perry.
I'd like to move it in.
Second.
Seconded, Representative Craven. Senator Moore. Did you have a question? Was your hand up, Senator Moore, for a question or a
I
vote?
apologize. I'm having problems with my earbuds, so I'm just trying to work through that. One of the questions I guess I had, I know this was part of the.
We're having trouble with your audio now. Oh, there we go.
Okay, can you hear me now?
Yes.
Sorry about that. These earbuds are not worth a darn. Anyway, we were curious because in the initiative justification, it talks about it to include the hiring of 2 parents. And we thought that was a little bit strange, and I wasn't sure. I mean, how are they going to decide on the parents? You know, I mean, I understand this is to contracted staffing, but that was my question about the hiring of 2 parents with lived experience in the child welfare system. Are we reading that correctly, Molly? I'm not sure.
You are, yeah. And Director Landry is in the attendees list and can speak to that really briefly.
Want to bring him in?
He's on his way.
I know
Very
he
good.
can also address the adoption subsidy question while he's here too.
Welcome, Director Landry.
Good morning, Senator Claxton, Representative Meyer, members of the committee. To answer your question, the 2 positions that we are contracting for with the Cutler Institute at the Muskie School are for 2 parents with lived experience, and we have specified one to be a father with prior lived experience and one to be a mother with prior lived experience in order to ensure those important perspectives. Those 2 positions will do a few different things. They're going to provide guidance and information and their perspectives on development of policies. They will participate in training, including our foundations training for our incoming and new caseworkers. And they will also be assisting us in researching and developing an evidence-based or implementing an evidence-based program for parent support, sometimes called a Parent Partners Program.
And the choice of one of the questions that Senator Moore raised was how are you going to identify those folks? Is that you or Cutler?
Cutler will have the primary responsibility for identifying those with support from the department, but they are in the process of posting and going through their posting process, and we're helping them spread the word, including through a number of organizations in the state so that we can get the word out that these opportunities are open for those with prior lived experience.
Is that good, Senator Moore? Okay.
Yes, thank you very much.
Thank you for that. There was also a question earlier about whether one of the line items include adoption support or not.
If you're referring to adoption subsidy,
Yes.
I believe is what you're referring to as it related to the table on foster care or foster parent resource parent reimbursement. Adoption subsidy is discussed and negotiated and worked out with every individual case on a case-by-case basis prior to the adoption being finalized, and it can be negotiated as a general rule up to level B on that foster parent reimbursement table. In addition, the youth who are adopted out of state custody retain their Medicaid benefits, so they stay on main care. And if there are any additional or unique situations related to medical expenses or other expenses that are unique to the child, those can be negotiated and continued on a case-by-case basis.
Thank you. Any other comments or questions? I have to admit,
Just thank you very much, Dr. Landry. Appreciate that.
I have to admit, I've lost track. Is somebody moved in line 34 and 35? Okay, and seconded. So we can vote. All those in favor of moving it in, please raise your electronic hand. I count 11. Thank you. Please lower your hand. Okay. Okay, Luke, I guess it's to you for line 38.
Having issues getting my mute to go down, but I think this will work for the moment.
Now I hear you.
So this is lines 30.
36 and 37.
I'm sorry, I wrote it in the wrong tab. 36 and 37. Thank you. Sorry, Luke, just to confuse you.
Yep. So lines 36 and 37, account 0137, the 4E Foster Care Adoption Assistance Program, provides funding to expand the Home Builders Prevention Program to serve reunifying families in all districts.
Any questions about that? That's close to LD 393. Reverend
I would
Perry.
Could I move that in?
Yes, thank you.
Second.
Second, Representative Craven. Any other comments, questions, discussion? All those in favor, please raise your hand for moving in LD 36 and 37. I count 11. Thank you. Now we'll go to 38.
All right. Now we're on to line 38. This is in the 0139 state-funded foster care adoption assistance account, and it provides funding for the implementation of family visit coaching.
All right. So any questions about that? Representative Perry, your hand up.
I'd like to move that line 38 in.
Second.
Second from Representative Craven. Any further discussion, consideration? So we can vote on line 38. All those in favor, please raise your hand. I count 11 in. Thank you. Everybody, please put your hand down.
Okay, now we're on lines 39 and 40. And these are both in the account 0307 Office of Child and Family Services Central Office. This establishes 8 secretary associate legal positions in the OCFS Central Program due to the increased legal casework. There was a question related to this from Senator Moore. Where will the positions be located in the districts they serve? And the response is the secretary associate positions will support the administrative needs of the district office by performing complex clerical responsibilities that involve completing and submitting court documents for child welfare. The 8 positions will be assigned to child welfare district offices.
So yes, Representative Javner.
Thank you very much, Senator Claxton. May I please ask for a 5-minute corner caucus, please?
Sure, it's a good time to take a break anyway, and we'll be back in 5 minutes. Very good. Is this pace working out okay, Anna?
Yeah, it's fine.
And if you've just joined us, we've taken a break here for some corner discussions, and we'll resume when enough of our colleagues are back. So you gave up in the earbud, Senator Moore? Are you trying an alternative, Senator Moore?
We apologize. She's still having technical difficulties with
Oh.
those.
That's too bad. All right, we can resume our deliberations now. Before we get to a vote on 39, line 39 and 40, I had a question for Molly and the department about whether this is this at least partially intended to offload some of the caseworker responsibilities that they would typically bear?
It is, yes, and Director Landry can elaborate if you would like.
Sure, please.
Thank you,
Dr.
Molly.
Landry.
Thank you, Senator. And you're exactly right. That is the intent. One of the pieces that we have heard from our staff is that over the course of the past several years, requirements for them as it relates to legal compliance perspectives, particularly court reports or other sometimes more complicated legal situations involving children in care, are requiring them to spend a significant amount of their time doing that legal work. And so the intent here is to help them with that work by hiring these positions that will offload, as you use the term, some of those responsibilities to these positions. These positions also would be responsible for developing templates and other ways that they can assist our staff to process that work more efficiently, thereby increasing their time to spend on much of their casework duties related to families and children.
Thank you. Okay. Has everybody had questions answered related to 39 and 40? And I think there's a motion on the floor and seconded. Any additional questions, discussion? Then we can vote it. All those in favor of moving in line 39 and 40, please raise your hand. I count 11. And please lower your hand. Thank you. So 41.
Yes, so line 41 is an account 0563 childcare services. This establishes one social services manager 1 position and 1 management analyst 2 position. And this is for the costs and salary supplements awarded to individuals who provide childcare or who are early childhood educators. So that's why the funding line is so large, because it's those positions along with the salary supplements.
Yes, Representative Javner.
Thank you, Senator Claxton. This will not be unanimous.
And just for clarification, Luke, is this related in any way to the 125% discussion?
No.
No, because it's an entirely different category.
Correct.
Right. Yep. Thank you. Representative Senator Baldacci.
Yeah, I wanted to ask in terms of the 12 million that's being proposed here, what changes in wages are we going to actually see for workers? If the deputy commissioner could tell us what the increase in wages for childcare workers is going to be because of this bill, because of this particular spending allocation.
Yeah, I know Director Landry can probably actually speak to that.
Okay.
I'll be happy to take that question. These will be provided via salary stipends, which was envisioned and put forward initially under Speaker Fecto's bill last year related to childcare workforce. As you may recall, we are currently using ARPA funds, Childcare Stabilization Grant ARPA funds, to provide $200 a month stipends to every direct childcare worker in the state. And so these stipends, the way that it is structured, these stipends would continue once the federal funds expire. Initially, they will be on the same $200 a month basis. However, the governor's budget and the speaker's bill both envision us moving to a tiered approach no later than July, I believe, of next year. And that tiered approach will be based on education and experience, with a minimum of 3 tiers and at least a 50% difference between the 3 tiers. So depending upon how that implementation works out and the numbers at different levels based on experience and education, the average amount of these stipends will be $200 a month. But once the tiering goes into effect, there will be differences with those with greater education or higher levels of education and more experience receiving a higher stipend versus those without.
Mr. Chairman, can I follow up?
Please.
So the 40 million we discussed was also had to do with giving higher wages and continuing the stipend. Is the 12 million going to be added to the baseline in future budgets? Or, I mean, how do those two numbers coalesce? The 12 million here and the $40 million previously that we discussed this morning?
I can handle that. The part of the 40 million is going towards childcare stabilization grants, what Director Landry just spoke about. Those funds expire on 9/30/2023, and then the $12 million general fund initiative would kick in so that there would be continuity between for childcare facilities and employees.
So the 12 million would kick in on October 1st, 2023 until the end of that fiscal year?
It would be October 1 of 2022 through the end of the fiscal year. Yes.
So the 40 million expires 9/30/2023 or 2022?
The 40 million expires 9/30/23. Those are the childcare ARPA discretionary grants, I believe. And so those have a longer runway. The stabilization grants end on 9/30/22.
And this is the initiative that the administration has worked on with Speaker Fecto and the 0 to 3 coalition that met significant number of times and held working groups over the summer and fall. And I see Tara Williams, who participated in that, has joined us. That 12 million will go into the baseline. It's an ongoing initiative that the governor and the speaker have worked on together. And the speaker's bill that has nearly identical language to what we were asking you to add in. I also wanted to flag that that was erroneously omitted from the budget, but has been included in our testimony to appropriations and in the email that I sent you this morning. That language, again, has been developed in partnership and passed the IDEA committee unanimously, I believe, yesterday, although time is a bit of a blur. It might have been Tuesday.
Yeah, no, I just wanted to have clarification as to what these two numbers we're working on, and I think you've answered that the 12 million will become part of the baseline budget. Is that correct?
Yes.
Okay, thank you. No other questions.
Senator Moore, did you have a question?
Yes, I did. What was the bill number? Representative Fecto's bill number? Do you remember it, Molly? The
Sure,
number?
it was 1652.
Thank you.
We've been joined to Representative Meyer. Did you have a question?
Thank you, Mr. Chair. I had my hand up to remind the committee that Speaker Fecto's bill had passed the IDEA Committee with unanimous support, as well invited Ms. Williams in to talk a bit about the impact on childcare in Maine.
Now that you're right side up there, Tara Williams, did you have something you wanted to contribute to our work?
Yes, thank you. I was having issues with my computer, so I'm on my phone and not used to Zoom on my phone. Can you hear me okay?
We can.
Okay, thank you so much for giving me a chance to add a bit of context. I think it's important to understand when you're seeing these different amounts of money, both federal and potential for state funds, what this looks like on the ground for childcare programs. So, hearing that over $100 million came to Maine for childcare this year, I know that is a big number. It sounds like a big number. I wanted to just add a little bit of context there that not only was this one-time funding, but it was designed to support a childcare sector that was in crisis. There were programs in the first year losing an average of $10,000 a month trying to stay open. And the initial federal packages that Congress passed sent enough money for some one-time relief grants to go out. Many programs in Maine were very thankful for these grants. They got, $3,000 in one relief package. They got $5,000 in another. For those programs, though, that were losing on average $10,000 a month, it was not covering their losses. And so when Congress passed the American Rescue Plan, it was the first time in the pandemic that enough money was allocated to childcare to really meet the need to stabilize the sector. And so the portion of funds, it's over 70 million that is designated to go out through these childcare stabilization grants. If you look at the 1,600 programs in the state, you'll then be able to kind of just do quick numbers in your head that we're looking at an average of about $3,800 per month per program this year to be stabilized, to get out of debt. And so I just wanted to add that. I think what's important to know about this line item that you're on now is that before the pandemic, we as a sector and as policymakers were looking at really long-time systemic issues. One of those being that childcare is built on the back of families with young children being able to pay. And we all know in our state that this is a struggle for many families. We're really thankful to have the federal funding that supports the childcare subsidy program to help many families pay for this cost. But the other thing that subsidizes this program is the low wages of early educators. And the only way to pay them more in the current system is to charge families more. And so our state, like many others, has been looking at strategies to support wages of those who work in childcare. And this is a strong strategy that has already been showing this past year to be effective, because we've already been giving out these wage supplements through federal funds in Maine. And it has, there's actually, if anyone wants to look at a later date, or you've been able to see some of the testimonies that came through the Appropriations Committee, many childcare providers wrote in about what they've been able to do with the funds that they've received, and the wage support that's been crucial to not just stabilizing the sector, but the workforce. And now I realize I'm going on very long, so sorry if that was too much. And if you have any other questions, let me know.
Thank you. Are there any additional questions on line 41? I'm not seeing any.
I would move it in.
Thank you, Representative Craven.
I would second that.
Representative Meyer. No additional discussion, so we can move to a vote. Please raise your electronic hand if you're in favor of moving in line 41. I count 7. Thank you. Please lower your hands. All those opposed to moving in line 41, please raise your hands. I count 3, 4. Okay.
Sorry. So sorry.
Thank you. Please lower your hands. That gets us to 42.
Do you need to see the language while we're at this one? The one that Molly sent this morning, this is the language that you would need to add to go along with it.
Sure, if you would.
Can you see that? That's the email that you got this
Yeah.
morning.
Okay.
So I don't know if you want to vote that now or you want to wait till it's language. It's up to you.
So how about if we wait until we get to the language consideration of the budget?
Okay, I'm just going to make sure you don't all forget it, because when it's not on our chart, one of us is going to forget.
Okay, thank you. That's BB.
Well, the point is it was forgotten.
Right.
So it doesn't have
Doesn't have
a
it,
line.
right.
It's not on the chart.
Okay. So we'll add that. It'll be there. And we'll have to have new and improved purple sheets.
All right, so
Okay.
we're on to line 42. This is account 0103, the Ombudsman Program, and this provides funding for the Child Welfare Ombudsman Program. And this is the one that also goes along with the language part BB.
Yeah.
I just want to point out before we forget, Luke, that there is an error in the language of BB. Health insurance is in there twice. It needs to look like 1960.
Representative Perry?
I would like to move line 42 in.
Second.
Thank you, Representative Craven, for the second. Any additional discussion? Representative, okay, all those in favor of moving in line 42, please raise your electronic hand. That looks like unanimous of those present. Thank you. Please lower your hand.
And we're on to line 43, account 0563, childcare services. And this reduces allocation for grants for the establishment and administration of the Help Maine Grow system and the First For Me Early Child and Education Program, authorized in PL 2021, Chapter 43, Part EE. And this is the one where this, I don't know how you want to do this, because line 43 and 44 are separate lines, but I just wanted to note that they do go together in the sense that the D allocation in line 43 is then being reallocated in 44, so you can see where the funding is now being located.
That'll be one of the puzzles for me as to why that line 44 isn't grayed out, but we'll do them one at a time.
Because they're separate initiatives, so they don't technically go together. That's why I did it that way.
They sure look like the same initiative to me.
Well, you've got to think of it, though, from the perspective of how you're voting things in and out. We never put, even if the department assigns things as together, like, oh, we're doing this and then doing this, we always have the legislature vote them separately as their own initiative, because the legislature doesn't always want to do it the exact same way. So that's why we keep them separate.
Okay, I'll let it go. All right, Representative Perry?
I would like to move line 43 in.
Second.
And Representative Craven has seconded that. Any additional discussion? All those in favor of moving line 43 into the budget, please raise your electronic hand. Looks like 11 to me. Please lower your hand. I'd entertain a motion on line 44.
Move it in.
Thank you, Representative Craven.
Second.
Representative Griffin, did you have a question or no? Okay, and that was seconded by Representative Perry. Okay. Senator Baldacci.
I'm just getting ready to vote.
Okay, you're warming up that hand. Is there any additional discussion before Senator Baldacci and the rest of us vote? All right, all those in favor, please raise your electronic hand. I count 11. Thank you. Please lower your electronic hand.
So we're
we
on
just dealt with those two distinct initiatives.
now we're on to lines 45 through 47. These are in 3 accounts: the 0147 medical care payment to provider account, the Z210 Medicaid services developmental services account, and account Z211 developmental services waiver main care. This provides funding to replenish 50 reserve slots for individuals who have been determined as priority 1 waiver program candidates under Section 21 support for adults with intellectual disabilities or autism spectrum disorder. And as we noted during the discussion around this, this is to create reserve slots. So as new individuals come on who are considered priority 1, they immediately have a slot in the program. There isn't a current wait list for that group.
Mr. Chairman, I would move this line in.
These lines, 45, 46, and 47.
Yes.
Second.
And as Representative Craven has seconded it. And as noted on the notes for this, the list is available on the ODE's website. I haven't had a chance to go there, but thank you for getting that, Molly. Any questions related to the lines 45 through 47? I'll entertain a motion then. You already moved in and seconded. Thank you. I'm catching up here. All those in favor of moving in 45 through 47, please raise your electronic hand. I count 11. Thank you. Please lower your hand.
Now we're on to lines 48 through 50. And these are in account 0129 Office of Main Care Services, account 0420 Long-Term Care Office of Aging and Disability Services, and account Z208 Developmental Services Community. And it establishes 2 developmental disabilities resource coordinator positions in the Office of Aging and in the Office of Main Care Services program, and 1 developmental disabilities resource coordinator position in the Office of Aging and Disability Services program.
Representative Perry, is your hand up? Nope. Any discussion of these
Mr.
lines?
Chairman, I would move these lines into the budget.
Thank you, Senator Baldacci and Representative Craven. Any discussion? Not seeing any, we can proceed to vote. All those in favor of supporting lines 48 and 49 and 50 moving into the budget, please raise your electronic hands. That gets us to 11. Thank you. Please lower your hand.
Now we're on to lines 51 and 52, which are in account 0129 Office of Main Care Services admin account, and account 0147, the medical care payments to provider. And this establishes an allocation in other special revenue funds in both the medical care payment to provider and Office of Main Care Services for savings accrued due to the increase in the federal medical assistance percentage per the American Rescue Plan Act of 2021, Section 9817, additional support for Medicaid, home, and community-based services during the COVID-19 emergency. Funding will be used to support services outlined in the state's Section 9817 spending plan and narrative. And as we discussed on Tuesday, these allocations are just $500 allocations, which essentially set up the account. Once the department is aware of exactly how much funding they'll be getting, they will do a financial order to increase that allocation to the right level, but this just sets the account up so the department now has that ability.
Representative Stover, your hand up. Representative, yes, it is. Representative Perry?
I would like to move line 51 and 52 in.
Second.
And thank you, Representative Craven, for the second. Any discussion? All those in favor of moving in 51 and 52, please raise your hand. That gets us to 11. Thank you. So takes us to 53 through 57.
Yes, and accounts 53 through 57 are in multiple accounts within DHHS and provides funding for services performed by the Office of the Attorney General. There was a question from Representative Javner and of what is causing the increase in the OAG work. The increase in OAG work stems from various sources over time across the 3 OAG divisions supporting DHHS: Child Welfare, Child Support, and Health and Human Services. The increase in work includes the increase in the number of children in care, mental health court hearings, consent decree compliance matters, settlements and appeals, among other activities. Note that this initiative increases funding for DHHS to continue to support existing work.
Are there questions about line? Yes, Representative Javner.
I do believe my hand was still up, but I'm thankful that it was. Yes, this won't be unanimous. Thank you.
Okay.
Mr. Chairman, I would move these lines into the budget.
I would second.
Thank you, Senator Baldacci and Representative Craven. Any further discussion? All those in favor of moving line 53 into the budget, please raise your hand. I count 7. Okay, please lower those hands. All those opposed to moving line 53 in, I count 4. Thank you. All right.
Now we're on to lines 58 through 61, again in multiple DHHS accounts, and this provides funding for technology and services provided by the Department of Administrative and Financial Services Office of Information Technology. There was a question related to this. What are the network fees? As background, Maine IT bills departments to cover the cost of their services. Network fees are one component of the billing, and the methodology changed, resulting in higher costs for DHHS. Network fees are the fee to connect computers together via Ethernet lines, wireless devices, switches, modems, etc., and maintaining that equipment. DHHS is paying for the connection, the equipment to handle the traffic, and the maintenance of that equipment.
I would move it in.
Thank you, Representative Craven.
Second.
Is there additional discussion? And we can vote on these items, line item 58 through 61. All those in favor, please raise your hand. I see 12. Thank you. Please lower your hands.
Now we're on to line 62 and 63. These are in the account 0142 DHHS Central Operations, and it provides funding for an increase in real estate taxes and other rent-related expenses at the DHHS Services building located at 109 Capitol Street, Augusta, as well as a base rent increase.
We're talking about the decision to rent as opposed to own last time. Representative Perry?
I'd like to move lines 62 and 63 in.
Second.
And it's been seconded, Representative Meyer. Any discussion, questions, concerns? So we can move to vote on line 62 and 63 to move it into the budget. Please raise your hand. I count 11. Thank you. Please lower your hands.
Now we're on line 64 and 65 in account 0142 DHHS Central Operations, and it provides funding for risk management insurance rate increases. There was a question from Senator Moore on this. What is the current baseline and what is the percent increase? In fiscal year 21, DHHS expenditures were $857,531 for risk management. Based on current headcount and the rates provided by the Risk Management Division of DAS, expenditures are projected to be $1,160,852 in fiscal year 22 and slightly higher in fiscal year 23. This represents a 35.37% increase.
Does that answer your question, Senator Moore?
Yeah, yes, wow.
Mr. Chairman, I would move this line item into the budget.
Second.
Any additional discussion? Boy. Yes, Representative Meyer?
I'm voting.
Okay, all those in favor of voting along with Representative Meyer, please raise your hand. Okay, I count 12. All right.
Now we're on to line 66 and 67 in account 0142 DHHS Central Ops. This establishes one senior legal advisor position, funded 6% general fund in DHHS Central Operations and 40% other special revenue in DHHS Central Operations. And there is language that goes along with this language, part DD. And there was a question related to this from Senator Moore. Why is a legal advisor needed in the department? As the largest department in state government, the DHHS commissioner requires a diverse and broad array of decisions, many of which are grounded in federal and state laws and regulations. A legal advisor would allow for operational efficiencies and provide legal advice and guidance regarding recommended administrative hearing decisions, contract reviews, and identifying departmental authority regarding initiatives to improve strategic planning and delivery of services. This position would collaborate closely with the Office of the Attorney General.
Mr. Chairman, I would move these lines into the budget.
Thank you, Senator Baldacci.
Second.
Second, Representative Craven. Any discussion, Representative Javner?
Thank you, Senator Claxton. This will be a divided report.
Very good, thank you. All those in favor of moving lines 66 and 67 in, please raise your hand. I have 7. 8. I have 8. And now you can lower your hands, please. And then we're looking for those who are opposed. I see 4. Thank you.
So now we're on to lines 68 through 71. They're in multiple DHHS accounts, and it provides funding to reimburse the Office of the Attorney General for one full-time Assistant Attorney General position dedicated to DHHS.
Did the earlier answer address your question, Senator Moore? You'd ask about the need. Okay.
I would move these lines into the budget, Mr. Chairman.
Thank you, Senator Baldacci. Representative Javner.
Second.
Seconded by Representative Craven. Representative Javner.
Thank you. This will also be a divided report.
Very good. Any further discussion? All those in favor of moving in line 68 through 71, please raise your hand. I count 7, 8. Thank you. Please lower those hands. All those opposed? I count 4. Thank you.
Now we're on to lines 72 and 73, which are in account Z036, Division of Licensing and Certification. This establishes one Public Service Manager 3 position in the Division of Licensing and Certification to serve as the Chief Operations Officer. There was a question from Representative Perry of what would the COO do? The DLC COO would be a part of the DLC leadership team and would support day-to-day logistics, ensuring best practices with financial management and workload analysis. The position will manage revisions of rules, manage provider appeals of department citations, conduct hearing preparation, and issues arising from the main background check center, among other responsibilities. The position is critical for the division's mission and essential to ensuring the health and safety of Maine residents by enabling the division to update regulatory requirements to be consistent with current standards of practice for health, safety, and changes reflective of national standards for infection control and emergency planning.
Mr. Chairman, I would move lines 73 and 74 into the budget.
72 and 73.
I thought it was 73 and 74. But,
No, it's 72 and 73.
okay, I would move lines 72 and 73. I was going to move 74 as well, but because it goes along with this, but I'll just move 72 and 73.
Second. Representative Javner.
Thank you, Senator Claxton. This will also be a divided report.
Thank you. Is there a second for this motion?
Second.
All those in favor of moving in line 72 and 73, please raise your hands. I count 8. Please lower those. All those who are opposed, please raise your hands. 1, 2, 3, 4. Thank you.
Now line 74, which is again in Z036 Division of Licensing and Certification, and it adjusts funding to align with existing resources. There was a question related to this. What is the status of the background check program? The goal of the main background check program is the protection and well-being of citizens receiving services in long-term care, residential care, and home and community-based settings throughout Maine. Use of the main background check program is mandatory for the following providers: hospice providers, home health care providers, nursing facilities, personal care agencies and placement agencies, temporary nurse agencies, adult daycare programs, assisted housing programs, residential care facilities, intermediate care facilities for individuals with intellectual disabilities, mental health services, facilities or providers, and drug treatment centers. In 2021, the main background check program conducted 2,181 background checks per month. Note that this initiative is required due to the insufficient allotment, which usually requires annual financial orders to cover program costs. The program has sufficient revenue to cover the increase in allotment.
Mr. Chairman, I would move line 74 into the budget. It is a critical tool for state DHHS to protect most vulnerable citizens. Thank you.
Second.
Thank you, Representative Craven, for moving that in. Representative Griffin, you had a question about this point in on this item. Did you get that answered to your satisfaction? I think the question was other special revenue funds versus special revenue funds.
Yes, that's good. Thank you.
Okay. There being no other discussion, we can vote on the motion to move in line 74. All those in favor, please raise your hand. I count 12. Thank you.
All right, so we're up to lines 75 through 77. And these are in the 0129 Office of Maine Care Services program and account 0140 Office of Aging and Disability Services Central Office. And this transfers and reallocates one social services program manager position from 50% general fund and 50 federal in Office of Maine Care Services to 100% general fund in Office of Aging and Disability Services to align the funding with the services being performed. There was a question here about what are the vaccine disparities grants? This was from Representative Javner. And it noted that the Office of Aging and Disability Services, alongside other DHHS offices, is working with the Maine CDC on 2 federal grant programs relating to COVID-19 immunization outreach and addressing health disparities in rural Maine and for people of color. Through these grants, OADS is contracting with community partners to target key population groups and offer additional vaccine education and in-home vaccination opportunities. Note that this position also coordinates the ongoing work for the ARPA Section 9817 Home and Community-Based Services Workforce and System Improvements.
Thank you.
Chairman, I would move line 75 into the budget.
Thank you, Senator Baldacci. Representative Stover, is your hand up to second?
Second.
Representative Craven, thank you. All those in favor of moving in line 75 through 70?
Excuse me, Senator Claxton.
I'm sorry, I got too many
Okay.
hands up already.
Yeah, I know. I'm so sorry. Representative Lemelin does have a question.
Oh, okay. Thank you for flagging that. You want to put your hand down, Representative Stover? Representative Lemelin.
Thank you, Senator. Yeah, I have a question. Since the hospitals reported to us that vaccines don't work anymore because half the people are vaccinated in hospitals and half are not, there are people on ventilators that are vaccinated. There are people in ICU that are vaccinated. So basically, they've proven that they don't work. So why are we going to pay $118,000 to continue doing vaccine information? Are we spending that money to inform people that the vaccines don't work? Because if it's anything else, then this is kind of a waste of money.
Representative Zager.
Thank you, Mr. Chair. Just on point of information, there is no medical authority that says that these vaccines don't work. The information that Representative Lemelin is referring to is not actually mathematically correct.
So in the interest of avoiding a back and forth, I think Representative Lemelin has been asked a question. I think Representative Zager has posited that there's a different interpretation to the data. I think I'd like to leave it there because I don't think it's going to move things from where we are. Thank you. The issue is 75 through 77. It's been made and seconded. Representative Javner.
Thank you, Senator Claxton. This will be a divided report.
Thank you. All those in favor of moving those 3 lines into the budget, please raise your hand. I count 8. Please put your hands down. All those opposed to moving in, I count 4. 2, 3, 4. Moving on. Thank you. Okay.
So now we're on to line 78, Developmental Services Community Account Z208. And this provides funding for the approved reorganization of 1 Social Services Program Specialist 2 position to a Social Services Program Manager position to better align the position with the work that's being performed.
Any questions about that? I'd entertain a motion to move.
I move line 78 in.
Senator Moore, do you have your hand up as a second? No? Okay. As a second, okay. Senator Moore has seconded that. All right, thank you, Representative Perry, for the motion. We can vote in the absence of any hands up. All those who are in favor of moving in line 78, please raise your hand. I count 12. Very good, thank you.
We're on to line 79, and this is account Z208, Developmental Services Community, provides funding for the approved reorganization of 1 Management Analyst 2 position to a Comprehensive Health Planner 2 position to serve as the Communications Manager for the Office of Aging and Disability Services.
Mr. Chairman, I would move this line into the budget.
Thank you, Senator Baldacci. Representative Perry, is your hand up as the second?
Yes.
Thank you very much. Any further discussion? All those in favor of moving it in, please raise your hand. And counting 3, 6, 7, 5, 12. Thank you very much. Every time you share your screen, Luke, it moves the lower hand.
Sorry about that.
It's bouncing back and forth. All right, thank you.
We're up to lines 80 and 81, and this is in the Office of Main Care Services account 0129 and the Developmental Services Community account Z208, and it provides funding for the approved reclassification of 2 mental health and developmental disability caseworker positions to human services caseworker positions, retroactive to September of 2020.
Entertain a motion.
I move it in.
Second.
Perry and Representative Craven, thank you. I'm not seeing any hands up, so we can move to a vote on moving in lines 80 and 81. All those in favor, please raise your hand. Eleven, 12, yay. Thank you.
So we're on to line 82, account 0140, Office of Aging and Disability Services Central Office, provides funding for the approved reorganization of 1 social services program manager position to a public service manager 2 position to align with the work being performed by the position and the requirements of the office.
Representative Stover, is that a motion hand? Okay, I'll put.
But I'll
mine
make
on.
the motion to move it in.
Thank you, Representative Stover, and seconded by, is that Representative Meyer?
Craven.
Very good. Any further discussion? All those who are in favor of moving in line 82, please raise your hand. Looks like everybody. Yep. Okay.
Now we're on to lines 83 and 84 in the Mental Health Services Community account Z198 and the Office of Substance Abuse and Mental Health Services account Z199 provides funding to achieve parity with main care medication management rates increased in Public Law 2021, Chapter 398.
I move that we move in lines 80, 83 and 84.
Thank you.
Second.
Thank you, Senator Baldacci. All those questions? All those in favor, please raise your hand of moving in line 83 and 84. Representative Zager, have you voted yet? That would be 12. You don't want to get a reputation like mine in the chamber yesterday. I was late in all the votes. All right, lines 85 and.
Yeah, 85 through 88 are in account 0129 Office of Main Care Services and account 0142 Department of Health and Human Services Central Operations. And this transfers 2 Public Service Coordinator 1 positions and 1 Public Service Manager 1 position and 1 Management Analyst 2 position from 50% general fund and 50% other special revenue in DHHS Central Operations to 50% general fund and 50% federal expenditures fund in the Office of Main Care Services.
So I'd entertain a motion.
I move it in.
Thank you, Representative Craven.
Second.
Several people seconded. Any further discussion? Representative Zager, you have your hand up?
Just trying to make sure I get my vote in.
Okay. Everybody who's in favor, please raise your hand. Touche. I count 10, 11. Okay, so that's 11. Thank you.
We're up to lines 89 and 90, which are both in account 0129 Office of Main Care Services. This provides funding in the Office of Main Care Services program due to increases in costs for financial accounting and human resource management services provided by Department of Administrative and Financial Services.
I move line 90 in.
Thank you, Representative Stover.
Second.
Thank you, Representative Craven. Let's see, let's put our hands. Is everybody who's in favor of moving in line 89 or 90, unless you have a question? I see 11. Okay, and please put your hand down. Not sure what that was, but I'm glad it's not on the green paper. Okay.
So now we're on to line 91, and this is an account 0142 Department of Health and Human Services Central Operations, provides one-time funding for public health emergency transitional case management services to those in need as federal COVID-19 related funding expires.
Yes, Representative Javner.
Thank you, Senator Claxton. This will be a divided report.
Thank you. Representative Meyer, is your hand up to make a motion?
Yes, I'd like to move this in.
Thank you very much. And seconded, Representative Craven. All those in favor of moving in line 91, please raise your hand. I count 7. All those opposed, please raise your hands now, and have the others who are in favor lower your hands. I count 4. Okay, thank you.
All right, line 92. This is an account Z018, which is the Main Care Stabilization Fund. This is actually just a line that's directly attached to the language part FF, which says, notwithstanding any provision of law to the contrary, the state controller shall transfer 30 million from the unappropriated surplus of the general fund to the Main Care Stabilization Fund established in the Maine Revised Statutes Title 22, Section 3174 KK on or before June 30th, 2022. And there was a question that what is the balance in the Main Care Stabilization Fund from Senator Moore, and the current balance is 54.5 million.
I would move line 92 into the budget.
I'll second that.
Moved and seconded, Representatives Meyer and Stover. Thank you, Representative Javner.
This will be a divided report.
Thank you. All those in favor of moving line 92 into the budget, please raise your hand. 6. I see 6. Though, please lower your hand. Those opposed. 1, 2, 3, 4. 6 to 4.
Sorry, Mr. Chair. I had to step away from one. I'm voting in favor.
Thank you very much, Representative Craven. Okay.
Right, we're on to lines 93 through 95. And these are all in account 0140 Office of Aging and Disability Services Central Office, and it provides an allocation to align with available grant resources.
Representative Meyer.
Thank you, Mr. Chair. I'd move 93, 4, and 5 into the budget.
Second.
Moved and seconded. Thank you, Representative Perry. All those in favor of moving in 93, 94, 95 into the budget, please raise your hands. Count 11. Okay.
Now we're on to line 96, and this is in account 0420 Long-Term Care Office of Aging and Disability Services. And it provides funding to reduce the wait list for the Office of Aging and Disabilities, Chapter 5, Section 63, In-Home and Community Support Services for Elderly and Other Adults program.
I would move it in.
And I'll
Thank you.
second that.
Representative Craven, Representative Stover, thank you. Any questions? All those in favor of moving in line 96 to the budget? I count 11.
Next is lines 97 and 98. And this establishes 3 comprehensive health planner 1 positions, 1 medical care coordinator position, and 1 management analyst 2 position, funded 50% general fund and 50% federal funds in the Office of Main Care Services program. This initiative also transfers all other personal services to cover a portion of these positions, which were previously procured through a staff augmentation contract. Related to that, there was a question asking when the contracts that we're talking about expire, and this current contract expires June 30th, 2022.
Representative Javner?
Thank you, Senator Claxton. This will be a divided report.
Thank you. Representative Meyer, are you moving this in?
I am.
Thank you.
Second.
Representative Craven, second. Thank you. All those in favor of moving lines 97 and 98 into the budget? I count 7. All those opposed after everybody else lowers their hand. I count 4. Thank you. All right, 99 through 102.
So 99 through 102 are all in account 0147 medical care payments to provider account. This is the first of the FMAP initiatives we're going to come across. This specifically adjusts funding as a result of the decrease in the federal medical assistance percentage for federal fiscal year 23. And this relates specifically to the CHIP FMAP, which is going from 74.8 in 22 to 74.3 in Fed fiscal year 23.
Representative Javner?
I would move lines 99 through 102 into the budget.
Thank you.
Second.
Representative Stover, thank you. All those in favor of moving in 99 through 102, please raise your hand. I count 11. Thank you.
Now we're on to lines 103 through 114. It's in many DHHS accounts, and it adjusts funding as a result of the decrease in the federal medical assistance percentage for federal fiscal year 23. This one is the regular FMAP, and that is going from 64% in Fed fiscal year 22 to 63.29% in Fed fiscal year 23.
Representative Craven, did you have your hand up for motion, or Representative Zager?
I move it in.
Thank you, Representative Craven.
I'll second that.
Thank you. All those in favor of moving in these line items 103 through 114? I count 11.
Now we've got lines 115 through 118. These are specifically in the DDPC and RPC accounts, and it adjusts funding for positions in the Riverview and Dorothea Dix psychiatric centers as a result of the decrease in the federal medical assistance percentage. The blended rate is 63.47 federal expenditures and 36.53 general fund in state fiscal year 23.
Thank you. Representative Perry or Representative Stover, is that a motion to move in?
I move
I
it
move
in.
them in. whichever.
And Representative Perry will count you as second in the race. All those in favor of moving LD 115 through 118 into the budget, please raise your hand. I count 10, 11. Thank you. Please lower your hands.
Now we're up to lines 119 and 120 in the medical care payments to provider account 0147. And this provides one-time funding for COVID-19 supplemental payments to hospitals.
I'll move that in.
Thank you, Representative Stover.
Second.
Representative Craven. Any Representative Javner?
Thank you, Senator Claxton. This will be a divided report.
Thank you. All those in favor of moving in lines 119 and 120 into the budget, please raise your hand. I count 7. All those opposed after we lower those hands. I count Representative Stover, Representative Craven, are you putting your hand down? Or up?
Oh, sorry.
That's
Sorry.
okay. I count 4 then. Thank you. All right, 121.
Yes. So
Senator
next,
Claxton,
Yes.
I'm sorry to, there was a lot of hand up and down. I just wanted to go back to 119 and just, I believe, that was almost $7 million in supplemental, one-time supplemental payments to our hospitals. Correct?
Yes.
Oh, thanks.
Okay. So now we're on to 121 and 122 and all the way.
it goes all the way through 144.
144.
Yes, and there's obviously many main care and other accounts included here. This repeals the consolidation of main care related programs and accounts contained in Public Law 2021, Chapter 398. As we discussed Tuesday, this is just repealing the account consolidation that was agreed to in the biennial budget. The net impact of all of this is 0. It just moves money from different accounts back to where they were originally.
Representative Lim, are you moving this in?
Absolutely, Senator. Thank you.
Very good. Thank you.
Okay.
I'm going to crave it again. All those in favor of moving these items 121 through several pages later.
144.
Thank you. 144. Please put up your hand. So I count 11.
All right, so now we're up to lines 145 through 152. This is, again, in multiple DHHS accounts, and this is the one that provides funding to reflect updated cost of living adjustments and to ensure labor components of rates equal to or at least 125% of the minimum wage, which was in Public Law 2021, Chapter 398, Part Quadruple A. There was a question related to this. There were actually a few questions, so I thought it would be best to at least go through those. So the first question was from Representative Perry. Wanted more info on the change in rate setting for admin component for waiver services. So in 2016, the rate study vendor Burns collected updated provider data for a rate study for Section 21. In 2020, DHHS updated some of those inputs based on more recent data, including an increase to the admin rate from 10% to 15%, consistent with findings from other recent rate studies for HCBS services. This updated approach was used for the rate increase for July 1st, 2021, and was originally developed in the summer of 2020. The admin cost component increased in the new rate study from the older 2007 rate study. Other rate components, such as program costs, decreased in the newer rate study. The changes in the amounts of the different cost components reflected updated provider data collected in 2015, along with the 2020 updates of the referenced admin rate change, plus updated wage inputs and updated hours based on 2020 claims. A review of comments from the more recent 2016 rate study did not indicate any issues with reported program costs at that time, or any concern other than the number of assumed hours of service. The department addressed this concern with the hours by updating the rate model with the actual hours of service. The bottom line is that the rate code with by far the most utilization, which is agency home supports, increased from $27.72 as of June 30th, 21 to $29.28 on July 1st, 21, a 5.6% increase, and is slated to increase to $32.13 as of 1/1/22 with the fiscal year 22 supplemental budget, a 15.9% increase since June 30th, 21. And a total of $43.79 million, 12.37, which is general fund, is scheduled to go to Section 21 providers in fiscal year 22, and another $71.35 million, which is 22.24 general fund in fiscal year 23 for ongoing rate increases.
Why don't we stop there and see if anybody have any questions about that? Representative Madigan? Any questions about that information on line 145? Okay.
All right, so the next question was from Representative Zager, and it was, what are the rate components? So rates are based on an analysis of provider costs and cost drivers, most commonly built using a rate model that basically determines a reasonable budget for providing a service based on the most common prevalent categories of costs for that service. Oftentimes, spending on one category has a relationship with spending in another category. For example, spending on administrative overhead may commonly vary in proportion to spending on direct care staff, wages, and benefits. So rate cost components is a way to refer to these different categories of costs, e.g. wage amount, staff to member ratio, program costs, for which inputs are entered into the rate model and divided by unit of payment to determine resulting rate amount.
Does that address your question, Representative Zager?
It does to an extent, Mr. Chair. Thank you. I'm just, there's a whole lot on this line item that Luke is reporting, and thank you so much, Luke, for this work. And so, you know, we might consider tabling this line item just because there's a lot to digest here. But I want to hear the rest of what Luke is reporting on this line item.
I would second that, please, the tabling motion.
Are you was that a tabling motion, Representative Craven?
Seconding Representative Zager's motion.
Okay. So the motion has been made to table. It's been seconded. All those in favor, please show a hand. Physical hand or electronic hand. Let's do the electronic hand. And we'll get a count. That looks like unanimous of those present to table. Thank you.
So, Senator, do you want me to continue with, and what first I should note, all that I'm reporting is just what the department provided. It wasn't my work, so I'm just the reader in this case. Do you want me to continue to answer the questions that responded to the lines that were just tabled?
Could we do that, please? Thanks.
Okay. So the next question was from Senator Moore, and it requested a list of services getting 125% increase and those getting the COLA. And I did this response. I sent the file that Department of Health and Human Services had provided to me, which was also part of the presentation. So that had the information that Senator Moore was requesting. The next question from Representatives Madigan and Zager was requesting a history of the ACT and TCM rate increases. So the last increase for these services was enacted in PL 2018 Chapter 460. So targeted case management, you can see here, went from $21.52 per 15 minutes to the current $21.95 per 15 minutes, where assertive community treatment for adults went from $59 a report to $60.25 a report. and assertive community treatment for youth went from $104.13 per report to $106.21 per report. The final question for this section was, are any TCM Section 13 not receiving at least 125% of the minimum wage? And it says here that Section 13, targeted case management, is not included under Part Quadruple A and thus not subject to the 125% provision. Based on current rate amounts and provider cost data the department has, labor components of the TCM rate support wages are above 125% of the minimum wage.
Representative Lemelin, is your hand up? I'm not hearing you, sir.
No, it's not, sir. Thank you.
Okay.
So the next lines, 153 through
Before we-
159.
Luke, can
Yep.
you stop? Can you stop the screen share for a minute? I want to make sure that the committee's had a chance to ask any additional questions related to the information that you just shared or advanced for us. Is there additional information the committee would like when we come back to this item? Is everybody feeling that the questions have been asked to the extent that we have been so far? Representative Craven?
Yes, thank you, Mr. Chair. I was wondering if we could have an outline of the methodology that was used to come to the to come to those numbers that the department used.
So you want to have somebody at the department, when we get back together, you want to have somebody from the department walk you through how the calculation was done for which portion, which rates?
For the quadruple A.
Okay, for quadruple A.
Yes, thanks.
Is that enough direction, Molly? Do you have some questions about that?
I don't think we could walk you through we could, but I don't think it would be helpful to walk you through the methodologies for all of quadruple A. I imagine you're talking about agency home supports under Section 21.
Right.
Yep, and there, I do want to, while I have your attention, the last 2 pages of the memo include a table that responds a little bit more fully to one of the questions around which sections have received which increases. And then the final page is additional information related to agency home supports that we prepared for the briefing that we provided to the committee and appropriations a few weeks ago. So that may be helpful as well. But we'll happily respond at the next work session.
Thank you. And then the question I had, and since it's your material, Molly, on the second paragraph of the explanation of line 145, it says the bottom line is the rate code with by far the most utilization. So my question is, what happened to the other rate codes that factor into the net for a given facility or for a given code? So what it says here is the rate code that's most utilized increased.
Sure. So all of the rate codes that changed as part of quadruple A increase, we singled that out because it was the one that we were hearing the most about. We can certainly provide you with a copy of the rate amounts for each of the sections, but the only reason that it's singled out there is that the agency home supports is the one that you've been hearing about and we've been hearing about.
And I guess the point what I'm trying to clarify is my understanding that that rate could have gone up, but program rates could have come down so that the net was impacted. That's what I'm trying to understand. What other rates affect the final rate?
That is the final rate.
Okay.
What is being discussed here is how large a rate increase should go to these providers.
Okay.
So there is one that code that we provided agency home supports. It accounts for more than half of the total spending in the waiver homes. It's hundreds of millions of dollars. That rate went up by 5.6%. Currently, it's slated to go up to it's slated to go up to what Luke read, another 15.9% over what was in place in June of 2020.
Yeah. Thank you. Are there any other questions of the department before we come back to this at a later date? All right. So we will proceed.
So next are lines 153 through 159. And these are in multiple DHHS accounts, and it provides funding due to an increase in inflation rates for main care services required to provide a cost of living adjustment. So this correlates to the lines we just discussed, but these are for the services that are only getting the cost of living increase. They're not part of quadruple A.
Any questions about that section? I'm not seeing any. So somebody want to make a motion about 153 through 159?
Move it in.
Representative Craven, thank you.
Second.
Representative Zager, second, thank you. Any further discussion? All those in favor of moving into the budget lines 153 through 159, please raise your hand. I count 11. Thank you. $160.
So we have now lines 160 through 162. And these are in the account 0147 medical care payments to provider and account 0202 low cost drugs to Maine's elderly. And this provides funding for Medicare Parts A, B, and D premium rate increases.
Yes.
Move in.
Okay, motion to move in. Thank you, Representative Craven. Any questions? All those in favor of moving in 160 to 162, please raise your hand. I count 11.
Next is lines 163 through 178 in multiple DHHS accounts, and it adjusts funding for the 6.2% increase in the federal medical assistance percentage rate. This is the FMAP increase that is due to the COVID public health emergency.
Representative Javner? Representative Meyer?
I move it in.
Thank you, Representative Craven. Any second?
I'll second that.
Thank you, Representative Stover. Any additional discussion, questions? Now, all those in favor of moving line, yes, Representative, oh, they already voted 163 to 178. Please raise your hand. Nine, 10. Senator Moore, are you voting on this one? 11. Thank you. I count 11. So that gets us to 179.
And this goes 179 through 185 in multiple DHHS accounts, and it provides one-time funding for increased non-emergency transportation broker rates.
I'll move those in.
Thank you, Representative Stover.
I second that.
Representative Craven. Any additional discussion about 179 through 185? All those in favor of moving that into the budget, please raise your hands. It's like 11 to nothing. Okay. All right.
So we're now up to lines 186 and 187. And these are in the account 0147 medical care payments to provider account, and it provides funding to implement new rates based on the fiscal year 22-23 rate study for inpatient psychiatric rates.
I'll move those in, please.
Thank you, Representative Stover.
Second.
Representative Perry. Any questions? All those in favor of moving in 186 and 187 to the budget? Ten. Representative Griffin, were you gonna vote with us? 11. Thank you. So before we go any further, Luke, I just want to touch base with the committee. In a couple, 2.5 hours, we want to break and then finish up after lunch, or do you want to keep powering through?
Yeah.
Okay.
Lunch.
How about half-hour lunch? Do I hear 30 going once? Okay. We'll take a 30-minute break for lunch. All right. Thank you.
Looks like they're on break until 1 o'clock.
Who's that?
HHS.
Sorry you're having so much trouble, Senator Moore.
Well, what we discovered is that the earbuds that I had didn't have a built-in microphone. So that's why you all were suffering, or couldn't hear me, or I wasn't understanding because I was trying to use the computer microphone. So I went and got some other ones that have a built-in one, and it's going in and out and not working all the time. It's a pain in the neck. Anyway,
When it works, technology is great.
it is. It is. Well, we were hoping we were going to be able to be hybrid since there were 4 of us, but that didn't work. So.
Yep. All right. So looks like folks are gathering again. And thank you for being here, Luke. I hope you got a chance to get something to eat or drink.
Just made it quick, that's all.
That you're doing so much of the talking, but all right. And thank you, Ben Mann, for being here too.
We wondered if you wanted to go back to the tabled lines on foster care before you moved on. 28 and 29, unless I'm misreading you, Representative Javner. I got the sense that you all might have been ready after Todd Landry was here, but if not, that's okay.
Let's just keep plowing ahead and then we can go back and regroup, and yeah, let's do it that way. Thank you though, Anna. So Luke, I think we are on 188 and 9.
That we are. So lines 188, 189 are both in the medical care payments to provider account 0147. And it provides funding for the removal of member copays for federally qualified health centers and rural health clinic services. And I'm going to hand it over to Sam for a minute because there is some language that will have to be added for this particular initiative.
Okay.
So this will just require some language to strike out some copays that are laid out in statute at Title 22, Section 3173C. So it'll just be some simple strike.
Okay. And so that'll be part of our language review at some to be designated alphabet combination.
Exactly. Yeah. When we go through the language, that can be a piece of new language that can be voted on.
Okay.
Just wanted you to hear it here while we were talking about the line, so it made some sense.
Plus, otherwise, it's a one-time event and would revert.
Well, otherwise, the department would not be requiring those premium and copays anymore, but the statute would still say that they should require it. So it's just to clear it up. Yeah.
Okay. So it's a language fix. All right. Any, yes, Representative Javner?
Thank you, Senator Claxton. I would move lines 190 to 191 into the budget.
I understood we were still talking about FQHCs on 188 and 189. Am I right about that? So is that a motion to move in 188 and 189? That's what I thought I heard.
I apologize. That's exactly what you heard. It's lunch brain.
Second.
I'll second that.
Okay, very good. Thank you, Representative Craven. All those, good thing we had a break so we're not punchy. All those in favor of moving 188 and 189 in, please raise your hand. I count 11. Thank you. Very
now
good.
we're on to lines 190 and 191. These are in the medical care payments to provider account 0147. And this provides funding one time to reflect different planned effective dates and approved effective dates in Resolve 2021 chapters 111, 112, and 118.
And these are specific dates unrelated to the 125% discussion?
Correct. None of these relate to that particular initiative.
Yeah, these are Medicare E&M codes and stuff like that. Okay. Representative Javner?
I would move lines 190 to 191 into the budget.
Sounds familiar. Thank you. So all those in favor of 190 and 191 into the budget, please raise your hands. Looks like unanimous of those present. Representative Zager, were you joining us in voting? You got your hand up. Is your electronic hand broken? Huh, okay. All right.
Now we're on to lines 192 and 193. This provides one-time funding for COVID-19 supplemental payments to family planning agencies. I believe there was a question here from Senator Moore of who are the family planning agencies. So the department responded, family planning agencies who provide main care covered services are Maine Family Planning and Planned Parenthood of Northern New England.
Thank you.
I would move it in.
Representative Craven wants to
Second.
move it in. Is there a second for that?
Second.
Okay, Representative Lemelin, did you have your hand up for discussion or raise a point?
Yes, sir. I definitely want to make a statement here. I'm just curious. I have two questions. One, why would we give COVID-19 money to an organization that, first of all, makes more profit and took in more money during COVID than the drug lords? And if anybody thinks I'm joking, I'll be glad to sit down with them and show them the exact figures that these people made a fortune. And number two, why would we give any money from our state to people who kill babies?
So the motion has been made to move it in. Is there a second?
Second.
I'll second that.
Okay, there's a second. Additional discussion. Did you have your hand up, Representative Meyer?
I did, Mr. Chair, and thank you for recognizing me. I just wanted to add to the conversation that this is the Joint Standing Committee on Health and Human Services of the Maine State Legislature, and is no place for misinformation and disinformation. Thank you.
All those in favor of moving in LD 192 and 193 into the budget, please put your hand up. I see 8. Please put your hand down. All those opposed to the moving those items in? I see 4. Thank you.
Next is line 194. This is an account Z198, Mental Health Services Community, and it provides funding for private non-medical institution rental subsidy contracts. And there were some questions that related. I see, Molly, I'm just going to ask you quickly because it shows that it relates to 194 and 195, but the question was about psych beds. So I just want to make sure that 194 in some way does relate to that.
Thank you. The initiative itself does not relate to that, but the question that we received was in the context of this initiative. So,
oh, okay. So let me just read the response then, and that might make it more clear. So the question was, how many psych beds are open? The response is there are 565 licensed inpatient psychiatric beds in the state. In terms of potential reasons for unfilled beds, a significant portion of the licensed beds are in double occupancy rooms, and it's not always safe, appropriate to put 2 to a room, so those beds can sometimes go unfilled. For residential psych beds, which are in private non-medical institutions, Appendix E, there are 771 beds in the state. 27 beds are currently temporarily closed offline due to staffing challenges. 34 beds are currently open filled, and 16 of those are due to facilities just opening and being in the process of filling beds. Other open beds are awaiting arrival of referrals who are discharging from inpatient or incarceration settings. For additional context, we have added 24 new PNMI Appendix E beds during the current state fiscal year and have 4 providers in process of adding new facilities.
Thank you. That represents new information to me. Related to line 194, are there any additional questions or Then I entertain a motion.
Move 194 in.
I second.
Thank you, Representatives Perry and Craven. Any additional discussion? All those in favor of moving in 194 into the budget, please raise your hand. I count 12. Okay.
We're on to lines 195 and 196. And these are both in the 0147 medical care payments to providers account. And this provides funding to increase rates for psychiatric residential treatment facility services.
I would move in 195 and 196.
Second.
Griffin, did you have your hand up? Okay, so thank you, Representative Craven and Representative, well, who seconded that? Stover. Okay. So the issues around 195 and 196 are additional conversation discussion. Okay. So all those in favor of moving in lines 195 and 196, please raise your hand. That's 12. Thank you.
Mr. Chair.
Yes.
I was having some technical issues earlier on line items 190 to 191. I wished to vote with the group.
190 to 191.
Yes, I wasn't able to unmute or raise the hand. The hover just did not work.
I think we included you based on the artificial, on the natural hand.
Yeah. Okay. Great. Excellent. Thank you.
Now we're up to lines 197 through 199. These are in the 0147 medical care payments to provider account and Z009 PNMI room and board account. And this provides one-time funding for a high main care utilization add-on payment to private non-medical institutions that care for residents who are older or disabled, which are the PNMI Appendix Cs.
Yes, Representative Perry.
I move those in 199.
197 to 199. Second.
Second.
Thank you, Representative Craven. All those in favor of moving in 197, 98, and 99 into the budget, please raise your hands. I got to 12. Thank you very much.
Next, we're up to lines 200 through 217 and many DHHS accounts. And this adjusts funding in various main care accounts to reflect impacts from the December 1st, 2021 Revenue Forecasting Committee projections.
Representative Meyer. Representative Craven. Representative Stover.
I would move those in, Senator Claxton. Thank you.
Second.
Okay, thank you. Any additional discussion? All right, all those in favor of moving in 200 through 217, please raise hands. Representative Madigan, were you going to vote on this one? That would make it 12. Thank you. Okay.
Now we're up to lines 218 through 224 in multiple DHHS main care accounts. And this provides one-time funding for an add-on payment to account for recent increased staffing costs, including costs associated with COVID-19 for nursing facilities and residential care facilities.
I move it in.
Thank you, Representative Craven. Second, Representative Javner. Okay,
No, excuse me. Yes, this will be a divided report. Thank you.
okay, thank you. Is there a second for this motion?
Second.
All those in favor of moving in 218 to 224, please raise your hands. Representative Stover and Madigan are invited to vote on this one. That have 8. And if
Sometimes
you
I'm
vote-
just juggling my sheets while I'm trying to click the button.
if everybody would lower their hands, then we'll find out about the folks who are opposed to moving these in. And I count 1, 2, 3, 4 opposed. Okay. Thank you.
Now we're up to lines 225 through 230. And these are in the account 0147 medical care payments to provider and account 0148 nursing facilities. This provides one-time funding for COVID-19 supplemental payments to long-term care providers.
I move it in.
Thank you, Representative Craven.
Second.
Representative Perry, thank you. Any questions or, yes, Representative Javner?
Thank you, Senator Claxton. This will be a divided report.
Thank you. Then all those in favor of moving in 125 to 225 to 230, please raise your hands. I count 8. Thank you. And those opposed, would you please put up your hands while everybody else takes theirs down? Hint, hint. So I count 4. Thank you.
Mr. Chair, just a quick question
Yes.
on 225. Does the $1.8 million general fund of one-time funding for long-term care providers, does that pull down federal funding as well?
Yes, and it's actually greater than that because a couple lines down, line 228 is also general fund funding.
Yep.
And that's another 5.6 million. But yes, both of those general fund lines carry a federal match.
Thank you.
Okay. That gets us to,
We're up to lines 231 and 232. These are both in the account 0453 Office for Family Independence District account. And this establishes 14 limited period eligibility specialist positions and 1 limited period family independence unit supervisor position, funded almost 38% general fund and 62% other special revenue within OFI.
I would
question.
move it in.
Thank you, Representative Craven.
Second.
Representative Perry. Representative Javner?
Thank you, Senator Claxton. This will be a divided report.
Thank you. All right, all those in favor of moving in lines 231 and 232, please raise your hands. I got 8 there. Please put the hands down and we'll see who is opposed. And I have 4 there, 8 to 4. Thank you.
Now we're up to lines 233 and 234. These are both in the 0143 Maine Center for Disease Control and Prevention account. And this continues and makes permanent 1 Public Service Manager 2 position, previously continued via other financial orders funded 60% general fund and 40% federal expenditures fund in the main CDC account to serve as the Associate Director of the Office of Health and Population Equity. As one we had earlier, this was a limited period position. It's continuing it, making it permanent. So now there is a head count that goes along with this position.
Thank you. Representative Jabner?
Thank you, Senator Claxton. This will be a divided report.
I move it in.
Thank you, Craven and Representative Perry. Thank you. Then all those who are in favor of moving in 233 and 234, please raise your hand. I see 8. Thank you. Please lower your hands, and those opposed. I count 4. Okay. Thank you.
Now we're up to line 235, account 0143, main CDC. And this provides one-time funding to support the purchase of a more effective and reliable child lead case management system for the lead poisoning prevention program due to the current system being outdated and not designed to handle the current caseload size.
I move it in. Second.
Representative Craven and Perry, thank you. All those in favor of moving in line 235, please raise your hand. I see 12.
We're up to line 236, still in 0143 main CDC. And this provides one-time funding for the in the Maine Center for Disease Control and Prevention General Fund to relocate the Health and Environmental Testing Laboratory in its entirety from 221 State Street, Augusta, to the East State Office Complex campus, the Greenlaw Building in Augusta.
I move it in.
Representative Craven and Perry, thank you. Additional conversation. All those in favor of moving in line 236, please raise your hand. 5, 10, 11, 12. Thank you.
Next is line 237, Maine Center for Disease Control and Prevention, account 0143, provides one-time funding to purchase PFAS testing equipment for the Health and Environmental Testing Laboratory.
Representative.
Move it in.
Thank you very much.
Okay,
Move in and seconded. All those in favor of line 237 going into the budget, please raise your hand. 5, 10, 11, 12. Thank you.
Next is line 238, Maine CDC, establishes 2 Chemist 2 positions and 1 Chemist 1 position, and provides funding for PFAS testing capacity in the Health and Environmental Testing Laboratory.
Move it in.
Second.
Thank you, Senator Claxton.
You had your
this will
hand
be a
up.
divided report.
Okay. Any other comments? Thank you. All those in favor of moving in line 238, please raise your hand. 5, 6, 7, 8. Thank you. Please lower your hand. Technically, Senator Baldacci, if I could see your face, that would be better. Can you? There we go. Okay, thank you. All right, so that would be 8-4. Would everybody else put their hands down now? And those are opposed, please put your hand up. I see 4, including me, 5, 4. Okay, thank you. So now we're on to 239.
And this goes through 246. And this is in Maine Center for Disease Control and Prevention, account 0143. And this provides allocation to align with available grant resources.
Move it in.
Second that.
Okay, so it's moved and seconded. Any other discussions, considerations? So those in favor of moving 239 to 246 into the budget, please raise your hand. 5, 10, 11. Good, thank you. That's 12.
Now we're up to line 247. This is an account Z289 Opioid Use Disorder Prevention and Treatment Fund. And this provides an allocation in the Opioid Use Disorder Prevention and Treatment Fund program to align with available resources.
I'll move that in.
Thank you, Representative Stover.
Second.
Representative Perry, thank you. Representative Moore, are you already voting? All those who want to join with Representative Senator Moore? No. All those in favor of moving in line 247, please raise your hand. I've got to 10 so far, 11. Representative Meyer, are you going to vote on this one? 12. Thank you. This looks like the last page, Luke, of the green paper.
Yeah, this is the last line on the green document. So this is line 248. It's an account Z199, Office of Substance Abuse and Mental Health Services. This provides funding for the continuation of the overdose prevention through intensive outreach, naloxone, and safety liaisons in all of Maine's counties. There was a question related to this program, so I wanted to get to that. So Representative Javner just asked for more info on the options program. So the overdose prevention through intensive outreach, naloxone, and safety initiative is a coordinated effort of the Maine Office of Behavioral Health and other state agencies to improve the health of Mainers using substances through harm reduction strategies, helping them on the road to recovery, and dramatically reducing the number of fatal and non-fatal drug overdoses. And it does note here at the bottom that Director Pollard presented information to the HHS committee in January of 22, and it includes the PowerPoint presentation that was used for that and some additional information as well.
Thank you for those links or reporting on those links. All right. Any those in favor of moving in line 248, please raise your hand. 5, 10, 11, 12. We made it through the green paper with only a few things tabled. We can come back to those.
And so I'm planning to switch over to the purple document now. I can actually get it to share.
Mr. Chair.
Yes, Representative
Meyer. Yes,
yeah.
Thank you. Just before we leave the green sheet, I missed the vote on the outcome of the vote on 237 and 238, the PFAS testing. Was that unanimous or divided?
Refer to my notes. 237 was unanimous and 238 was divided 8-4.
Okay, thank you.
Representative Madigan, did you have a hand up for any of this language stuff? No, okay. Go ahead, Luke.
All right. So the first item, line 249, is part BB. This language is the language that is the same as that of the original bill for LD 1960, and it relates to line 42 in the green document, and it's the changes to the ombudsman program.
Luke, I just want to point out that you can't see this in your chart, but there is an error in the language as it's drafted on the web, and I believe it relates to number 4 with the health insurance. You can't see it here. I'm just letting you know this was a technical correction, that health insurance is in the paragraph twice, and it should look like the language in 1960. And other than that, it is the same. but there is a little bit of stray language in that piece that doesn't actually belong. I'm just letting you know that we would fix that.
Molly?
That's all correct. I just also wanted to note that it doesn't include the seat on the Child Death and Serious Injury Review Panel like you added for the Ombudsman in 1960. So if you wanted to add that, you would need to make note of that here.
Any other comments? Did I see Senator Moore? Were you agreeing that that's what, was that what you were trying to flag?
Yes, that's what I was going to bring up, and Molly beat me to it. So there we go.
Very good. Representative Meyer, do you have your hand up?
I do. So as Molly just indicated, we need to note that here. So I wanted to move that if that needs to be moved.
With the amended version being the addition of item number 11, which gives the seat on the
Correct.
yeah.
Second.
Fatality and Serious Injury Committee. Yep. So with that change, any other comments? Anybody want to move in part BBB with the amendment? Yes, Senator Baldacci.
We're going to have another session regarding the bills, some in terms of language review, or I just want to make sure that everything we do is consistent with some of the
I'm having trouble hearing you, Senator.
Okay, we're going to have another session on bills or language review. Is that correct?
Yes.
Yeah, right. I know what you're getting at, Senator. We haven't yet got the fiscal note for LD 1960, so that's why I haven't brought it back yet.
Okay. No, I just want to make sure that we stay consistent with the bills that we've already voted on, and in terms of this budget. In case, so my understanding is that we'll have to come back and discuss the fiscal note when it comes. Is that correct? Or
that's
for
correct.
LD 1960, yes.
Okay, I appreciate it. Thank you.
Okay. So as far as BBB as amended, it's been moved and seconded. All those in favor of moving in BBB, please raise your hand. That looks like it's unanimous, 12. Thank you. If you lower your hands, we'll go back to the chart.
So the next one is line 250, which is language part DD. And this part adds a Department of Health and Human Services senior legal advisor position to the list of positions appointed by the commissioner, and adds a senior legal advisor to the list of positions whose salaries are subject to adjustment by the governor. This relates to lines 66 and 67, which you just voted in the green document.
I move it in.
Representative Perry, thank you.
Second.
And Representative Craven. Any additional questions? Okay, so those in favor of moving DDD into the budget, please raise your hand. I count 7. Representative Craven, were you voting on this one? 8. All right. Please lower your hands and we'll hear from the folks who are opposed. I see 1, 2, 3, 4. 1, 2, 3. We're missing. There are 4. There we go. Thank you. Okay.
Now we're up to line 251, which is language part EE. This part repeals the language associated with the consolidation of main care related programs and accounts approved in Public Law 2021, Chapter 398. Due to technical adjustments that would need to be made in the volume of main care related systems work already in process, this initiative cannot be completed within the required time frame. This relates to lines 121 and 100 through 144 that you just voted on the green document.
Thank you.
I'm ready to put that in.
I heard it moved in and seconded. All those in favor of moving in line EE to the budget, please raise your hands. 12. Thank you very much. And down.
Next is line 252, and this is language part FF, and this part requires a transfer of $30 million in fiscal year 21-22 from the unappropriated surplus of the general fund to the main care stabilization fund. This relates to the line 92 that you already voted on the green document.
Mhm. Representative Lemlin, did you have your hand still up or again?
I move it in.
Okay, moved and seconded. All those in favor of moving in line FF or language FF into the budget, please raise your hands. Looks like 8. Thank you. Hands down, and then those who are opposed, please raise yours, and I count 4. Thank you.
Next is language part GG. This part authorizes the Department of Health and Human Services to transfer savings incurred from the increase in FMAP per the American Rescue Plan Act of 2021, Section 9817, from various general fund main care program accounts to other special revenue fund accounts in the medical care payment to provider and the Office of Main Care Services programs to be used for federally authorized purposes. This relates to lines 51 and 52 that you voted in the green document.
Move it in.
Thank you, Representatives Craven and Perry. All those in favor of moving GG into the budget, please raise your hand. 12. Unanimous, thank you.
So the last piece of current language for you to vote on is line 254, and this is language part HH, and this part allows the Department of Health and Human Services Office for Family and Dependents to carry forward any unexpended balance of the $1,335,770 appropriated in Public Law 2021, Chapter 1 to meet reinvestment obligations for penalties incurred in the Supplemental Nutrition Assistance Program in 2019.
Move it in.
Thank you, Representative Craven and Stover. All those in favor of moving HH in to the budget, please raise your hands. Looks like 12 again, Anna. Lower your hands. Okay.
So that's all of the lines that were on the purple document, but as we've gone through the green document, there were a couple of additional pieces that it sounded like the committee was thinking about adding. I know one related to line 41 in the green document, specifically around in the child care services program, the salary supplements that would be awarded. And there is some language I believe you wanted to add around that.
I can bring it up if you need it.
So that's on page 11. You know, I'm not remembering that. Oh, that's the tiered supplement portion. And that's related to line 41. Molly?
Yeah, just if it's helpful to refresh memories, this is what Tara Williams and Director Landry spoke to you about earlier today, and is the language that provides the structure and the authority for the department to develop the salary supplements that are referenced in the initiative. So happy
to end up with a tiered structure as of a certain date. Okay, President Perry?
Yeah, it would be helpful if we could see the language before we voted on it. So if that's something that could be sent out before we meet again on the budget? Or are we going to meet again on the budget?
It was in your email and I just had it on the screen. But as you can see, this email went to all of you. Tell me when to take it down.
Okay. So Representative Perry, are you seeing that under section 1, salary supplements?
My memory has now been refreshed.
All right. So we're voting, we're considering some language that has not got any letters attached to it yet. Is that right, Luke and Anna? I mean, does this become
That's correct.
Well, no, because there's language for other parts of the budget and other committees. We'll just attach
Right.
it in your memo. So we don't know what letters it will be.
So this is TBD 1 letters, right, to be determined?
We usually just put section with a little blank and then somebody else will fill it in at the end.
Okay. So the section with the blank or to be decided 1 endorses the language of getting the health department getting to a tiered system for the supplements or the salary supplements. Is there a motion?
I would like to move in the language for the tiered child care payments listed in item 41.
Thank you, Representative. And a second, Representative Meyer. All those in favor of moving in that language with the understanding we'll have a chance to see it again, please raise your hand. I see 8. Hands down, please. Those opposed? I see 4. Thank you.
So the last item that I know of was some new language attached to line 188, which is on page 32 of your green document. This was the item that removed member copays for federally qualified health centers and rural health clinics. And Sam had mentioned that this is simply a striking of Title 22, Section 3173C, which is what requires those copays.
Pull it up if anyone wants to see it. I've got it.
So, Mr. Chairman, I would move to include that.
Thank you, Senator Baldacci.
Second.
Representative Perry seconds it. So we would be striking language that requires copay.
It's just these 2 subparagraphs here, R and S. Just strike them right out in the copay list in statute.
Okay, R and S, okay. And that's what line? 180?
188, yep.
188, okay. Okay, so everybody comfortable with understanding what we're voting on? All those in favor of striking that language to make consider. Representative Javner? Is that a vote? It is a vote. Okay. 5, 10, 11, 12. Thank you. All right. Any other comments or thoughts at this point? What is the committee's interest in going back to any of the tabled items? Do we want to put that on agenda for next week, or do you want to try and come back to them now?
How many tabled items do we have, Mr. Chairman?
How many what?
How many tabled items do we have, Mr. Chairman?
I can remember two so far, but it may be, is that right, Anna?
I think so. It's lines 28 and 29. And what's the other one, Luke? The
other one,
quadruple A?
yeah,
Where
it's
the
the quadruple
A
A
is.
thing, and I'm looking now.
Well, we might as well do them now since we're here.
I thought there was added information asked for. And I would like to wait until we
Yeah,
get.
I would like to wait for the quadruple A's.
Right.
I agree.
There was for quadruple A, but not for the other one. Yeah. It's 145, Luke.
If there's additional information, that's fine.
And line 28 and 29 was about adoption subsidy and kinship care. Those are the two outstanding questions that I understood and that I thought I heard Director Landry answer. Are people okay with going back to those two items? Usually I look to Senator Moore and Representative Javner. Are we okay going back to those two items? Those two lines?
Senator Claxton, I am okay in going back to it, but I did have another question related to the foster care. I know that the data we were provided gave us the number of, trying to find it again here. That was 28. It gave us the number of resource homes, but it said the resource homes include kinship care and non-relative resource / foster homes. The question that I'm still being asked from one of my constituents is actually how many foster homes do we have, or licensed homes?
Oh my Lord.
That's the one number I don't have because it's all lumped together in the answer here in the response.
Is that something you want to take a shot at, Molly, or you want to bring it back?
Just to confirm, you want the kinship numbers broken out from the overall foster homes?
Yes, that's correct, Deputy Mann. Thank you. And I don't want to hold up the voting on the line, but I just would like to have that information because I've been asked for it and I haven't been able to provide that. And that was part of my question, when we were going through the budget on Tuesday. So yes, if I could just have a breakdown between what's kinship and then what is licensed foster homes, that would be great.
Certainly.
Thank you.
Well, there's going to be potential overlap because some of the kinship are licensed foster homes. You're going to be able to separate the licensed foster homes who are kinship also from that list.
That's a good point.
Yeah, we'll do our best. I mean, the licensing can
Because
be.
oftentimes the kinship are required to get a license for initial placement before there's custody. So.
That's a good point, Senator Baldacci.
Well,
Yeah,
no, I
thank
just
you.
want to make sure that we're not comparing apples and oranges. I understand Senator Moore's point, and I agree it would be helpful information if we could have the kinship placement numbers and the foster parent non-kinship numbers, if that's possible. If it's not, I think I'll take what information you have, but it would be helpful to kind of differentiate those two categories. That's all I'm saying.
Does that give you enough direction, Molly, to?
Yes, certainly.
Okay. All right. So Senator Moore, did I hear you say that even without that information, you're comfortable voting on these two lines, or would you rather wait?
No, yes, I'm okay in voting with it today, Senator Claxton. Thank you for asking.
Okay. Representative Stover, did you have a question? Representative Zagard?
Not about this, actually. I'll wait until after the vote. Thank you, Mr. Chair.
Okay. All right. So the item on the floor is on the table is lines 28 and 29. And the question is whether to move them in.
Senator Claxton, I think we have to take it off the table first.
Yes, thank you. Okay. Well, show of hands, are we okay with taking lines 28 and 29 off the table? That's unanimous of those present. Thank you, Senator Moore, for reminding me. So I'd entertain a motion on 28 or 29. Senator Moore,
I would make the motion to move lines 28 and 29 into the budget.
Second.
second Representative Craven, thank you. All those in favor of moving 28 and 29 into the budget, please raise your hand. Well, okay, 12. Thank you very much. So that leaves one item on the table still. And we can do that in a pretty quick order next week. So we'll be meeting with the chairs, leads, and analysts. We're meeting to do the scheduling for next week shortly, I think. And we'll come up with the best calendar we can. And then we'll see everybody on Friday before then. Did you have your hand up, Representative Stover? Representative Perry? Did you want to say something? Okay, Representative Zager, you said you had a comment.
Yes, sir. Thank you very much, Mr. Chair. So I was, unfortunately, I had to hop to another committee for a period of time. Are there any votes that would be consequential, or are there any votes that were close enough that it would change the report out of committee? Is that something that, no? Okay. Thank you very much.
Okay.
I will just send an email to whoever's not around for all of the votes, and that includes Representative Connor, so that they can represent. I mean, they can register their votes. They can just do it with me. It's not like bills where you have to do it through the Speaker's office or whoever, however that works.
Presiding officers.
Okay. Thank you very much.
Okay. Is there any other to come? Anything else we need to be doing this afternoon, Anna, other than when we get to the chairs lead scheduling meeting?
Nope.
Okay. And you all set, Sam? Okay. All right. And so as I think we should thank Luke for his patience and Ben Mann for the background information. And we're grateful for getting us through this, 41 pages. And Molly, for your doing whatever you do to facilitate these things, because you do a lot of it. So thank you all for your help with this process. That being the case, I think we can count on adjourning until tomorrow at 10.
Do you want to give me a time for me to start the chairs and leads? So because I have to set it up.
Yep. What do you think, Senator Moore and Representative Javner?
I apologize, Senator Claxton. Actually, I didn't even hear you.
The question is how soon do we want to convene chairs, leads, analysts meeting for scheduling? Do you want to take 15 minutes or do you want to take 3?
15 would be great.
Okay, so let's meet, Anna, to answer your question at 2:15. That makes
Okay,
it closer.
I'll have to send you all a new link, so look out for that.
Yep. So that'll give us 20 minutes.